a note from Karine Jean-Pierre, who is the White House press secretary, saying that the president has COVID. And I'm going to read to you some of what she described. She mentions, of course, that he is fully vaccinated, that he's been boosted twice, and that he's experiencing very mild symptoms, according to her words. He has begun taking Paxlovid, which, of course, is meant to treat COVID, consistent with CDC guidelines. They say he is going to isolate at the White House and will continue to carry out all of his duties fully during that time. He has been in contact with members of the White House staff by phone this morning, she says, and will participate in planned meetings through the White House via phone and Zoom, etc. So he will be isolating here at the White House, and you can assume, of course, that those events will be canceled later today. They also say that consistent with White House protocol for positive COVID cases, he will continue to work in isolation until he tests negative. So that means that it could be a few days before he is able to get out of isolation. Once he tests negative, they say he will return to in-person work. Now, this is significant because this is the first time, of course, that he has had COVID. He is also the oldest serving president, so that introduces a whole host of questions, of course. But again, has been vaccinated, has been boosted twice, will isolate here at the White House. But huge breaking news, considering this is the first time he has had it, and also considering that he had a travel schedule later today.
Indeed, and I imagine, there are a number of people who are often in close contact with the president. I don't know what the protocol was before, whether or not they were limiting people in light of this new variant. But do you know, if not what's happening now, what the general protocol is moving forward? Will other people around him be tested? Will they be trying to determine how he contracted COVID?
Yes, absolutely. I can tell you that there is contact tracing here at the White House. I've experienced that. If someone that you are in close contact with tests positive, you are supposed to wear a mask here at the White House. If you are part of pool duty, which we were last week, you have to test before being able to enter the premises. And we have had several members of the president's close staff test positive before. Remember, Jen Psaki has had it. Lots of members of the president's staff have had it, but he has often been described as not in close contact. So this will be another question about who else will potentially have to isolate after being in close contact with the president.
Yeah, and let's not forget, he just came back from a trip to the Middle East.
Exactly.
When Ed O'Keefe was talking about it, he said that there was some discussion about whether or not the president will be shaking hands, and he sort of fist bumped some people he didn't shake hands at all. But some people, as the trip went on, you did see images of him sort of being pretty close to other people.
Absolutely. And so that is a big question as well. And as you mentioned, he just returned from that trip. So there will likely be a list of people who were in close contact with him. As you mentioned, he was just traveling abroad and in close contact with others, including world leaders. So that will be a question. But huge breaking news out of the White House today. And again, we'll be updating when we have more information. This is just coming out, this announcement that just hit our inboxes a few minutes ago.
And so the video that we're showing right now is from the president yesterday. He was talking about his administration's plan to tackle climate change after, getting a bit of a setback in terms of the reconciliation bill. And today the plan was to go to Wilkes-Barre, Pennsylvania, and he was going to be talking about gun violence and the administration's plan there as well. So I sort of have a two-part question. What was the president going to be talking about? What is the plan? Will we see him at all and talking about the gun legislation or the things that the administration has been doing? And why is he making these sort of public appearances?
Yeah, Anne-Marie, he was supposed to go to Pennsylvania today to talk about the bipartisan gun reform measure that passed last month, but also to talk about the ways in which this administration is taking on the issue of crime. And this is a really interesting and difficult, actually, political issue for the president heading into the midterms. You may remember earlier this week, we reported on Democrats in Maryland in a governor's race there trying to kind of compete against each other to show that they are tough on crime. This is, of course, 2 years after some in the party were talking about defunding the police. The president was supposed to go to Pennsylvania today to talk about more funding for the police, investing in training for police officers, while also investing in programs. They were also going to talk about, pushing Congress to continue gun reform measures, pushing an assault weapons ban, which of course is going nowhere in Congress. But the importance of this trip was to show that they acknowledge that crime is an issue. It's registering as a top issue for voters, among other things, and it's becoming a particular liability for Democrats heading into the midterms, where Republicans want to keep that as the focus. So TBD on his travel schedule, Anne-Marie, but I will read a little bit more from this statement that we received. We know that the president's last COVID test was Tuesday, and in that time he had tested negative. This is standard protocol for the White House. The White House medical unit, we are told, will inform all close contacts of the president during the day today, including members of Congress and any members of the press who interacted with the president during yesterday's travel. So they are doing that contact tracing, and they did say that on Tuesday he tested negative. So this is a new test, and of course it is a positive result.
Before I let you go, just really quickly, because we're going to talk to Dr. Celine Gounder. When did President Biden return? Can you remember the date? You've probably got a better memory than me.
I believe it was Sunday.
Okay. So maybe like about 3 days ago, the show.
Yes.
Okay.
And but the last test that he took was Tuesday, according to the White House, and that was a negative test.
Okay, great. Caitlin Huey-Burns, thank you so much for jumping in there. We're going to flip over to Dr. Celine Gounder. She's the editor-at-large for public health at Kaiser Health News and an infectious disease specialist and epidemiologist at NYU Grossman School of Medicine at Bellevue Hospital. You're our go-to doctor whenever we're talking about all things COVID, particularly the latest developments. You're joining us on the phone, Dr. Celine. So, the reason that I wanted to get the information about when the president returned in the last test is because I wanted to sort of ask you about the timeline. We don't know, where the president picked up COVID, where he contracted it, but he was in the Middle East. He was dealing with people outside of his immediate circle. We know that he returned over the weekend on Sunday. He had a test on Tuesday that was negative. And so last Tuesday, actually, that was negative. So I guess, are you surprised at all by the timeline when it comes to his positive test today?
Not really. He's been in contact with a lot of people, both over his travels as well as his routines back at home in D.C. And we know that the BA variant is the most infectious to date. And we also know that they've been relaxing protocols somewhat around COVID. Yes, they're still testing, but in terms of masking and being around people in indoor spaces. So it's not really surprising. I think the good news here is he's double vaccinated and boosted, and so is at very low risk for severe complications.
What about so he is experiencing mild symptoms, but then why put him on Paxlovid?
Well, he is over 50, so he's older, and we do see a benefit of giving Paxlovid to people who are older in reducing the risk of hospitalization. This is the President of the United States. You want to minimize the risk as much as possible.
And you talked about his age. Can we talk about just how much of a risk that it is? I mean, he's not just over 50. I'm quickly looking it up to get the exact age of the president. But he is in his age. Oh, he's 79. So he's 79. I mean, that's a lot more than over 50. How vulnerable is he?
Well, to my knowledge, he does not have any really critical chronic medical conditions. So to my knowledge, he's not somebody who has heart disease, diabetes. He's clearly not obese. Those are some of the big risk factors for severe COVID, and he really doesn't fit any of those.
We reported earlier today that this new Omicron variant, BA.5, is now it's something like 80% of the cases that we're seeing in the U.S. It's definitely taken over. This is the path that we've seen when new variants emerge, and they are unchallenged. Who is particularly vulnerable to this variant? You said that, age is a factor, but he doesn't have any major health issues. Are those the people that really need to protect themselves beyond being double vaccinated and boosted?
Well, the people who we're seeing the highest rates of hospitalization and death, they're the unvaccinated, so people who have still not been vaccinated. And then older people, people with chronic medical conditions, people who are immunocompromised, those remain the really high-risk groups for complications. Even if they have been vaccinated, getting that second booster is really a way to ensure that you have additional immunity to protect you're in one of those groups.
I think more and more we're hearing about people who are contracting COVID. And I know there are going to be a lot of people out there that say, what is the point of taking, any of these measures? What's the point of masking up in close, crowded environments? It seems like you're just going to get it anyways. What do you say to people?
Well, look, I still have not got COVID. I've been wearing a mask throughout the pandemic when I'm indoors in public places. If you wear a mask, a high-quality mask, so when we say high quality, that means an N95 or KN95. If you wear it correctly over your nose and mouth and you wear it consistently, masks really work. And it's important to understand the vaccines are designed to prevent severe disease, hospitalization, and death. They are not designed to prevent infection. So if you want to protect yourself against infection, you need to have layers of protection with a mask.
And really quickly, and then I'm going to pivot over to Ed O'Keefe, but I still want to sort of keep you around. I'm just learning now that the First Lady tested negative. I know you don't know what's happening in the White House, but we've seen this before where people who are pretty close, one tests negative, one tests positive. Would you suggest that the First Lady keeps getting tested over the next few days? Could there be sort of a delay in terms of her positive diagnosis? Or do you see this sometimes where people who spend an awful lot of time together don't necessarily pick up the virus from the other?
Well, it's both. It's not 100% certain that she will contract the virus herself, that she'll be infected. At the same time, she has been exposed. This is when we talk about somebody should be quarantined. They've been exposed. We don't know if they've been infected. And so to keep them away from others, at least until we figure out what's going on, she is somebody I would be monitoring and testing daily for the next several days.
Dr. Celine, if you can hang on, that would be great. I want to bring in Ed O'Keefe, who is standing by. Ed, you were the correspondent who was traveling with the president overseas in the Middle East. And I remember sort of in his first stop in Israel, we had a conversation about whether or not he would be shaking hands, whether or not he would be adhering to some sort of COVID protocol. And eventually we saw him fist bumping. And I remember thinking to myself, what's the difference between a fist bump and a shaking of hands? But I'm curious about whether you saw his behavior with different people sort of change over the course of that trip, whether or not there seemed to be strict COVID restrictions in place or looser ones.
Well, good to be with you, Anne-Marie. In essence, he got off the plane in Israel and fist bumped various people, but then within moments was shaking hands.
Right.
And later that day was in pretty close contact and face-to-face with regular, everyday Israelis plus Israeli leadership. When he went to Saudi Arabia, there was that infamous fist bump as well, and he was in meetings with Saudi leadership and others on Saturday at what they call the Gulf Cooperation Conference, which was a gathering of Arab nations, Gulf nations in Saudi Arabia. I mean, look, if the medical... Go ahead.
Sorry, Ed, I'm hearing that there's a special report coming as soon as
Let's do it.
All right, we're gonna interrupt you, Ed. We have a CBS News special report about the breaking. It's not ready yet. Okay, Ed, we're gonna keep talking to you, but I may interrupt you again. Sorry for being rude. So you were sort of giving us a sense of just how many people he was exposed to while he was on this trip.
Right. I mean, if we do the math, inevitably this was something that happened while he was overseas, most likely. And so there'll be a question of who he was in contact with. We don't recall seeing him much in a mask over the course of that trip. And he was not wearing a mask, for example, yesterday in Massachusetts, for that event he held on climate change. So, inevitably this looks to be probably is a very similar case to other people who think that they may or may not be taking precautions and, of course, get caught up in it. And it'll be no surprise. And frankly, I've been waiting having come off that trip, waiting to hear whether there would be anybody who tested positive. You know, there have been too many other examples of colleagues or officials going overseas this summer for whatever reason and coming back with COVID.
All right, Ed,
So,
I'm going to cut into you. We're going to take you over to CBS News Special Report.
This is a CBS News Special Report. I'm Tony DeCopel in New York, and we bring you breaking news from the White House, where President Joe Biden has tested positive for COVID-19. We are told that the president is experiencing mild symptoms, and he is positive after a negative test Tuesday. And despite being fully vaccinated and twice boosted, he got that second booster shot on March 30th. For more on what we know at this hour about the president's condition, how he may have contracted it, let's go to the White House and Caitlin Huey-Burns, who is standing by for us. Caitlin, good morning. They're saying mild conditions that we have in the statement from the White House. Do we know anything more?
Hi, good morning, Tony. Yes, mild symptoms is how the White House is describing it. They mentioned that he was last tested for COVID-19 on Tuesday and tested negative at that point. We are also learning that the First Lady tested this morning, and she has tested negative. She is heading to Detroit. The president was expected to go to Pennsylvania today for a campaign, for an event to talk about gun proposals and fighting crime. He was also supposed to have a fundraiser later this evening. We are told that the president is now in isolation according to CDC protocols, and he is going to continue to be in isolation until he tests negative. They are also working on contact tracing, so talking to everybody with whom the president was in close contact. That means staffers, that means members of the press. Remember, he was just on a trip abroad. He just returned from Saudi Arabia on Sunday morning. So contact tracing will be going on, but they say these symptoms are mild, that he will continue in isolation until he comes with a negative test. Tony.
All right, Caitlin, thank you very much. Also joining us is Dr. Celine Gounder. She's an epidemiologist and CBS News contributor. Dr. Gounder, the president, as we said, is fully vaccinated. He's been twice boosted. Symptoms are, in fact, not just mild, but very mild, according to the White House, and he's begun to take Paxlovid. However, he's 79 years old. That is a risk factor. What should people know or think about the president's condition?
I think it's very reassuring that, one, he's been double vaccinated and double boosted. He is a healthy 79-year-old with no, to my knowledge, chronic medical conditions. So chronic medical conditions would include diabetes. He's clearly not obese. Those are the kinds of things that really put you at risk for severe disease. He also has started Paxlovid, which we know further reduces the risk of hospitalization. And of course, he would have access to monoclonal antibodies should his condition deteriorate in any way.
We have the president's health report from the White House doctor from 2021. He does not use any tobacco products, according to that, does not drink alcohol, works out at least 5 days a week. So given the background that's been made public about this particular patient, patient number one in this country inside the White House, how long might the president be in isolation out of a normal working situation?
We're seeing people with this Omicron subvariant, the BA.5 subvariant, takes about 10 days on average. You know, everyone's a little bit different. Some people will be a little bit shorter, some people a little bit longer. But 10 days is really the average for people to recover and become test negative.
All right, Dr. Celine Gounder with some context and background on the coronavirus and this particular patient, what we know publicly. If you're just joining us, we came on the air to let you know that President Joe Biden, according to the White House, has tested positive for COVID-19. He is taking Paxlovid at this time and is experiencing what the White House describes as, quote, very mild symptoms. We will, of course, be following it, and there will be more to come on your local news on this CBS station, also tonight on the CBS Evening News. Many of you will now return to CBS Mornings. This has been a CBS News Special Report. I'm Tony DeCopel, CBS News, New York.
So we're going to continue the conversation here on CBS News. Of course, the news you just heard that President Biden tested positive for COVID. Ed O'Keefe is still on the phone with me now. Ed was traveling with the president on his recent trip to the Middle East. And Ed, you know, one of the things that we were talking about right before the special report is, you know, the president, like many of us, myself included, you know, we have been sort of incrementally relaxing our vigilance when it comes to COVID. Now, the president is vaccinated. He's double boosted. I imagine there's a pretty sort of strong protocol for those who are around him, that they would also have to be tested regularly and vaccinated as well. In fact, let me sort of ask you, if you are going to be in close contact with the president, what are the guidelines?
You have to be wearing a mask in the sort of days or hours leading up to that. You have to test negative in order to do so. There have been instances around the White House where, for example, we've seen the White House Chief of Staff, Ron Klain, wearing an N95 mask amid a sea of people who aren't. And if anything, that has been an indication of these are the people who are going to be in the Oval Office with him most closely. And they have to take the most protection to protect him. I can tell you candidly, Anne-Marie, a few weeks ago, there was a bit of a potential exposure scare at the White House, and somebody who I had been in close contact with tested positive, and within a few hours, the White House medical office called. And this is how the contact tracing works. They'll say to you, have you been in close contact with any of the four principals in the last day or so? And the four principals are the President, First Lady, Vice President, and Second Gentleman. Answer to that was no. Do you have any plans to be in the presence of the top four principals anytime soon, is the next question. And what they then say is, if you do, or you find yourself in their midst, you know, make sure you wear a mask, keep your distance of about 10 feet, and you know, and take all the other CDC protocols. But the work that the White House medical office has been doing over the last 18 months since he took office is quite intense, quite specific, and designed to keep any sniff of COVID away from him. So if the system worked, it was very likely that somebody who he was traveling with or somebody he met in the Middle East had it and passed it along to him, as it's been passed along to all sorts of people. I got to think this will be a bit of a sort of, you know, embarrassing moment perhaps for the Saudis or the Israelis to worry that perhaps he got it while he was in their midst or because he was with them. We'll wait and see for the reaction there. But I also say this, the White House, despite all of these precautions and despite some of the theater that went on last week with fist bumps versus handshakes, has in the back of their mind always anticipated this would happen because they understand the science, that inevitably most people are going to get COVID unless they are in complete isolation, which a president cannot be, and this president certainly does not want to be. So the way with which we were informed this morning in a written statement, the assurances that he is isolating up in the residence, probably there on the second and third floors, where he has sort of a home office that he can work out of, and inevitably they've anticipated this and taken other precautions inside the house that we're not aware of. But see here, for example, part of what will be tricky for the White House is now sorting out all these people we see around him in these images here. Who among them may already have it, may get it in the next few days, and letting those people know is going to be Herculean. But again, they have had protocols in place for this and have anticipated it. And the real test of it now will be, as they vow in the written statement that went out a little while ago from the press secretary, daily updates, some sense of how he's doing on a regular basis, and inevitably when he is able to get back to work, what he's like then. Because obviously somebody his age, although quite healthy, who exercises regularly, you know, there are concerns about elderly people who contract this and their ability to rebound quickly. But, you know, be assured he has the best medical care possible for a president at his disposal. And as we saw with former President Trump when he got it, if needed, they can rush him to a medical facility off campus there in Bethesda, Maryland, for further review. But for now, if the White House is saying he has mild symptoms and is isolating and working from the White House, he'll do that. And how long he'll have to be there and whether or not we will see him at some point remains to be seen.
You brought up President Trump, and of course I can't help but sort of like, that's exactly sort of the image that I remembered, was him walking by himself to the helicopter to be taken to the hospital. And I was just thinking about sort of the difference in the approach that the two White Houses have taken when it comes to telling the public about the health of the president.
Yeah, well, look, we're only an hour into this, but so far they have been transparent and upfront about what happened and what precautions are being taken. And there will be questions every step of the way, and it'll be a real test of this plan that they've had in place for this inevitability. I mean, obviously something they hope to avoid, but something I think because they, as they like to say, follow the science and understand the science, knew that was possible for this 79-year-old man who likes to be out and about with people, and who, like everyone else, has struggled with the protocols and the theater and the different steps we need to take to inevitably get this. And we'll see how he is as a patient in the coming days and whether we hear from him. And of course, we inevitably there will be conversation about the fact that, there have been concerns expressed by fellow Democrats about his age and his ability to do the job. But, this White House is pressing ahead. They're anticipating re-election. And privately, I can recall, some Democrats or some White House officials saying in the past, he probably should just get it to get through it and sort of remove that vulnerability and then be able to say, I've endured this and survived it just like everybody else. And I understand the difficulties of it now, having been through it.
Yeah.
So.
Sorry, Ed. I was gonna actually bring in Caitlin Huey-Burns, who has been standing by the White House. Caitlin, the president is just coming off of this foreign visit, this Middle Eastern visit. The reviews were mixed about whether anything was done, that positive or negative, and he left behind a host of domestic issues that he had to tackle. So he returns. It looks like he's kind of on a little bit of a tour to publicly tell Americans what he's doing to tackle climate change, to tackle gun violence. And so I guess the question is, how much of a wrench does this put in the president's future plans over the next week or so?
Well, the president was supposed to travel to Pennsylvania today to talk about ways in which the administration is doing things that they were doing to combat violence and the rise in crime across the country, and to talk about that bipartisan gun reform legislation. He was also supposed to have a fundraiser this evening in Philadelphia for Democrats ahead of this midterm election. What was interesting about the White House statement announcing that he had COVID was that they were saying, yes, he's in isolation, but he is continuing to work. They made that point to say he is continuing to work. He is talking to people on the phone, going to be talking to people through Zoom and through other ways of communication. So they were also describing these symptoms as, quote, very mild. So this was a way to put out a message, of course, to the whole world that he is, doing okay, that he is working. But you're right, his domestic agenda was front and center, supposed to be front and center today. You and I were supposed to talk about this proposal that he was going to be talking about in Pennsylvania, this funding to address the uptick in crime across the country, touting the bipartisan gun bill, but also trying to show, as Democrats are becoming increasingly vulnerable on this issue of crime ahead of the midterm elections, talking about investments in police officers and other kinds of infrastructure, and also talking about funding the police, not defunding the police, as had become a message among some Democratic activists over the past couple of years in the wake of George Floyd. So that is a politically kind of tricky situation right now, but the White House is making it they're adamant that the president is continuing to work and is taking Paxlovid, that medication.
Okay, Caitlin Huey-Burns, thank you so much. I'm going to let you go because I know you got a busy day ahead of you, and we want to bring in White House reporter Bo Erickson, who's here to talk about some new details that we're getting. Bo, what can you tell us?
So what we're learning, Anne Marie, I'm inside the White House right now. Caitlin works on the outside of the White House. What we're learning is the president's symptoms, according to Dr. Jha, who is the president's chief COVID advisor here at the White House. The president's symptoms is that he's tired, he has a runny nose, and he has a dry cough. And Dr. Jha says the president went to bed last night. He felt fine, but he didn't sleep well. So these are the symptoms he had. They said in the statement earlier that he has very mild symptoms, and those are he's tired, runny nose, and a dry cough. And he's also taking that Paxlovid medication to try to get him on the mend as soon as possible. This was a big push that the White House and the administration has been doing to try to make Paxlovid available throughout the whole country. And now the president is using it himself. What we have also learned, I've been texting with the First Lady's spokesperson, Michael LaRosa, as I've been sitting here. And currently, the First Lady, Jill Biden, is in Michigan, in Detroit, at a few events with the Education Secretary, Mr. Cardona. The First Lady's spokesperson tells me that she is keeping her events. She's first going to be in Detroit this morning, and then she's going to Georgia for more events. And later tonight, I was told the First Lady is returning to their home in Wilmington, Delaware. This was always the plan, but obviously, the president and the First Lady will be separate for at least the next 24 hours or so for until she may be returning, or maybe she will have to be isolating. It does not know if there's a full plan right now.
Right.
And while you've been talking to Ed and Caitlin, our great colleagues here in the White House unit, Kristen Brown, she's been compiling a list of people who the president has been around in the past 48 hours or so. And these are really important people. We are unsure if the White House is actually going to say if they are, quote unquote, close contacts, meaning they've been with the president for more than 15 minutes. But just to tick off a few names, yesterday, who traveled with him to a trip to Massachusetts, Senator Ed Markey from Massachusetts, Senator Elizabeth Warren, 2 members of Congress as well, and also a whole list of White House staffers. And these people include the press secretary, Gina McCarthy, who's his climate advisor. We have his very specific close aides as well, who kind of talk to everyone in the White House. So those people, I'm assuming, will be testing right now. As Ed said earlier, they are always required to wear masks when they are with the president in a very confined space. And then if we look ahead a day, so this is about 48 hours ago, we saw the president and the First Lady greet the First Lady of Ukraine, Olena Zelenska, on the South Lawn. We do not quite know how much time the president specifically spent with the First Lady of Ukraine, but we know the First Lady, Jill Biden, spent a lot of time with the First Lady of Ukraine. And then when we keep looking at the First Lady's travels throughout Washington, she was meeting with members of Congress yesterday. And so there's, I'm assuming, going to be a lot of contact tracing happening throughout Washington, D.C. here in the next couple hours.
Yeah, it's going to be really busy. A lot of people going to need testing. I think Caitlin Huey-Burns said that the statement said that the president was last tested last Tuesday. Do you know what kind of the testing protocol is for the president? Is he tested on a regular basis or as needed, depending on how much contact he's had with other people? Do we know anything about that?
This has been something that the White House has been saying that is happening, but we really haven't gotten specific details of when the tests do happen and when they do not happen. Usually we only find out if the president has tested negative in the past when reporters have really pushed, or they proactively said potentially before a trip or before he met with someone that he has tested negative. They have not always said why and why not the president is tested, but clearly today, based on the symptoms potentially and him not sleeping last night, they felt the need to test the president.
Right. I want you to stand by, Bo. We want to bring in Reuters White House correspondent Jeff Mason, who was with the president just yesterday. I guess did you travel with him when he was talking about his climate change plans?
I did indeed. Yes, I was on the plane yesterday, and I can augment a little bit of what your other 2 colleagues were saying. The president was around a lot of people yesterday, and I can also tell you from having been on Air Force One that not everyone was wearing masks, including some of the senators, including Gina McCarthy, at least when she came back and briefed us. So, and there was also a small what we call a gaggle with reporters after at the end of the trip at Joint Base Andrews when the president came out and spoke directly to the pool. So he was around a lot of people, and so I would agree with the previous statement that a lot of people will need to get tested today.
You know, I was thinking about President Biden and kind of like his political style, if you will, is to be kind of up close and personal. You know, he sort of likes to sort of to touch people and get close to them and crack jokes. And I wondered just how much of the protocol has been relaxed over time when you have a guy whose whole style is about being really personal.
Yeah. You know, I've covered President Biden since he was vice president under President Obama. And I can tell you, you're absolutely right in your assessment that he is a touchy-feely guy. I mean, he's very tactile, and that's how he likes to deal with politically and with friends as well as people he's just getting to know. But I've seen his style change a little bit, and it absolutely has changed, I think, because of COVID. So I don't think you see that as much as you used to with the original, if I could say that, Joe Biden. But it doesn't mean he's changed completely.
I mean, Ed O'Keefe was just saying that there was a kind of feeling within the White House that this may be inevitable. That they need to prepare for the possibility of the president testing positive. Did you sort of ever have conversations in regards to that?
Yes, and in fact, Jen Psaki, the former press secretary, used to say that directly from the podium. Karine may have said that as well, that they absolutely know that it's possible that he'll get COVID, and we're prepared for it. And I think that we'll see them underscore that in the coming days. Also, they're going to want to, as we've already said on this broadcast, underscore that he's continuing to work, particularly if his symptoms stay fairly mild. But, you know, he's in his late 70s, and that makes him a higher risk. But it's also at a point in the pandemic where if you have all of the shots, which he obviously does, and have access to medication, which he also does, that the risk is a little lower. And that's something they'll want to underscore as well.
So I want you to just hang on for a second. We're going to go back to Bo Erickson, who is inside the White House. And Bo, you've got a little more information for us.
Yeah, we just got a letter that was sent by the president's physician. His name is Kevin O'Connor, and it was sent and shared by the White House through the press secretary. And it runs through like the medical terms of the president's symptoms with COVID. But then it also, in this last paragraph, says the president is fully vaccinated and twice boosted. So I anticipate, this is the doctor saying this, that the president will respond favorably to the Paxlovid medication he's taking, as most maximally protected patients do. The doctor goes on to say early use of Paxlovid in this case provides additional protection against severe disease. The doctor says the president will isolate in accordance to CDC recommendations, and that the doctor is saying that he will keep the White House updated with any changes in his condition or treatment plan. That is according to Kevin O'Connor, the physician to the president, and he also works at GW University down the street. We've also been trying to figure out what kind of contingencies are going to be taking place. We know from the statement that the president is, I guess, well enough to keep working, because they say that he is going to continue to participate in the meetings at the White House via phone or Zoom from the residence. And for those people who may be not as familiar with kind of the layout of the White House as we are here, the residence is the top floor of the White House. It is far removed based on levels of the White House, but it is a short walk from the West Wing. It's the press briefing room is kind of not too far below. So the president will be nearby. He's just going to be on a completely new level, but we are still trying to figure out what specifically else may be taking place to try to keep the president isolated inside the White House. Because if you remember when President Trump tested positive for COVID back in 2020, he was actually needed to take out of the White House to the president's medical area a few miles away from the White House. But right now, it looks like the president is going to remain in the White House.
All right, Bo, keep us posted if you get any more information. Thank you so much.
Thank you.
We are now going to bring in Chief Washington Correspondent Major Garrett, who is also joining us from Washington. Major, there's no good time to contract COVID, of course, but it seemed like the president had a lot on his agenda that's going to be sort of slowed right now.
Yeah, the president's going to have to isolate. He's going to have to completely reassess his workflow, and he can't engage directly with anyone in the White House for some number of days, probably at least 5. As someone who contracted COVID in late May and rapidly got on Paxlovid, that's really not of import to anyone except to say that Paxlovid worked very well for me. I'm twice vaccinated, twice boosted, and as soon as I got on it, whatever nominal symptoms I had disappeared. But that didn't mean I could stop isolating, and it won't mean that for the president. At least 5 days, as long as he tests positive. And his very active schedule the last couple of days means a considerable amount of contact tracing. And though at a moment like this where there is legitimate concern about the president's health, you can't take politics out of this. And the political reality, Anne-Marie, is this. There is one issue right now amid all of these negative polling assessments of President Biden and his administration that still is net positive: management of COVID. Well, this is an inconvenient occurrence in that one area of political positivism for the Biden administration. And yes, Jeff Mason, who covers the building every day and he does expertly for Reuters, a good friend of mine, pointed out the White House has said, when asked, that a positive test for the president is probably, if not inevitable, near inevitable. But has it adequately prepared the country for this? Now, one thing happened earlier this week. The president's chief medical advisor, Anthony Fauci, said, if you're asking me, can I retire when COVID is over, I'll have to be 105. We're going to have this for a long time. Well, that's part of the messaging that we have to understand, that COVID and its various subvariants are going to be with us for a considerable period of time, but it's much more manageable if you're vaccinated and boosted. And the idea of perpetual or near perpetual boosting to continue to ward off this particularly nasty virus is also something we have to prepare for, pay for, and distribute. All of that is part of the work of the White House. It will have a higher, more visible profile now that the president has tested positive.
I can't help but to think back to the Trump administration when President Trump also tested positive. And the statement that the White House released, one of the paragraphs begins, "out of an abundance of transparency," which I can't, I thought back to, whether or not they were making a comparison to the previous White House. Can you talk a little bit about what the country sort of went through when President Trump tested positive versus what we're seeing now?
Oh, sure. The atmosphere was completely different. COVID was everywhere. It was ever present, and it was lethal. It still is lethal, but it was lethal at numbers that shocked the mind and shocked the conscience and shocked the understanding of medical professionals who were looking at it and trying to treat this very, very tough virus on the fly. And President Trump, as we learned later, not in the moment, we had some suggestions of this from then White House Chief of Staff Mark Meadows, was very, very sick, and that his respiratory issues related to COVID were much more dire than described in the moment. And he had to go to Walter Reed Medical Center for extensive treatment, and he got some very important interventions, which at the time were kind of on the edge of experimental in terms of antivirals and other interventions medically. And they all worked. And the country was very glad to see that. But it was a serious medical episode for President Trump. We learned later just how serious a medical episode it was. Now we know President Biden has it. We have a doctor that's putting out statements regularly. I imagine this White House will, if not put out daily, near daily statements on the president's progress and his prognosis and how he's dealing with it. I bet you they'll make a statement very soon, maybe within 24 to 48 hours, about the effectiveness of Paxlovid. Because as it happened, and I'm not trying to make this about me in any way, shape, or form, Anne-Marie, but the week that I got COVID, I actually had Dr. Fauci on the Takeout, my program. And he walked me through it, and he said Paxlovid is our recommended national intervention strategy. So if you get it, get on Paxlovid right away. As it happened that week, there was a massive effort by the administration to amplify that message and distribute Paxlovid more accessibly. Well, that's now out there. It's all part of the conversation. The White House is going to have to deepen its involvement in that conversation about, yes, COVID is around, subvariants are real, you can catch it, contact tracing is still a thing we have to do, testing is a thing we have to do, maybe more than we're doing now to catch cases, and that you can manage it if you contract it.
Major Garrett, hang on for me because I'm being joined right now by Christina Ruffini right here at the desk. Christina, it's really good to see you. You know, I was asking Major about how the Trump administration handled the news that the then President Trump had contracted COVID compared to what we're seeing now. And you were there. You were covering the story. You were at Walter Reed.
I was. I actually started the day on the Hill because it broke late in the day and we had this announcement and we went out to Walter Reed. And at first it was just a big media circus, as things in Washington tend to be. And the Walter Reed is across the street, and so you had all these cameras set up. But, you know, the Trump White House had a very different approach than the Biden White House, and everything was a little bit more showy. So, you know, the second day we were there, he did that now infamous drive-by where he got in the car with Secret Service agents, potentially infecting them to what then was a much more serious virus, and drove right by, and I could see the president, you know, in the limo. It wasn't the Beast, it was the SUV, waving at people. And it was a very interesting and seemed like a much more histrionic event. Whereas this, you know, I think we should expect from the Biden administration, they're not going to want to make a big deal of this. They're going to want to keep it quiet for a lot of reasons. You know, as we've mentioned, COVID hopefully is not quite as serious as it was then for a lot of people. He's been vaccinated, he's been boosted, but it's also just a very different approach to communications. It's a much more restrained response in general. It's much more top down, whereas a lot of people in a lot of the other administration, frankly, it was better for sourcing because you could get people to speak from the hip. They're a lot more locked down here. So it'll be interesting to see how they roll this out and what information we get when we get it. But they have been very protective of questions about President Biden's health because they know it is something voters are looking at. He is almost 80, as we've been talking about. You know, there have been a lot of polls, including CBS News polls, where his approval ratings are down and people are looking for someone else to run next time, and age probably factors into that. So there is a heightened awareness of, even though he has all these protective measures, what this could mean for a man of his age, a man for, you know, anybody who's almost 80. This could be a serious thing. However, as we saw with President Trump, and Major just mentioned, who was quite ill at one point, Walter Reed is amazing medical care. The president gets the best medical care that we can offer, and so hopefully this will be just another one of many Washington, D.C. COVID cases we've been grappling with over the last
isn't that
couple
the
weeks.
truth? And I just thought, you know, even though the country is in a very different state when it comes to COVID, something that both you and Major sort of brought up made me think, you know, both of these administrations were trying to sort of project the same thing. We have a handle on this, right? But Donald Trump's approach was to almost sort of balk at the seriousness of it. I will walk to the helicopter myself. I will wave to the crowd from the vehicle. President Biden is also sort of grappling with something very similar in that fewer people are dying, but it's really confusing, I think, to many people that they're getting vaccinated, they're getting double boosted, and now they're finding out that more and more of their friends and relatives, and now their president has tested positive.
Well, and you have to think, you know, you hear from the CDC, you hear from the COVID advisors, you probably should be wearing a mask. You probably should be not going to massive concerts. You probably shouldn't be getting on, well, they haven't said this, but every time I get on a plane, I think, should I be really sitting next to this many people for this many hours? However, it's a bit of the same problem the Trump administration ran into. They want to project confidence. They want the economy to keep going. They want people to put money back into the economy and go to work and go to stores. So they have to walk this fine line. And if you notice, as I think Ed was mentioning earlier, you haven't seen President Biden in a mask a lot. And that's a deliberate effort because they want to project that we are moving past this and we are at a place now where he can go and he can do diplomacy overseas and he can shake hands with diplomats in Israel, in Saudi. You know, I traveled with Secretary Pompeo at the beginning of COVID when nobody was traveling, and it was very strange to see these diplomats, look how much we covered the fist bump between President Biden and Mohammed bin Salman, right? In diplomacy, these little things really mean a lot. So it means a lot to be able to shake a hand, because that's something Secretary Pompeo and even Secretary Blinken at the start of his term couldn't really do in a lot of places. I went to Japan with Secretary Blinken and everybody was masked, and it was like you see these very prestigious diplomats running up to each other and awkwardly fist bumping or elbow bumping or doing, like teenage sixth grade dance physical awkwardness because they don't know what to do. So it's part of all of that soft power projection to be able to say, we are America, we have conquered this enough where I, the president, can go out, I can shake hands with friends and allies, I can shake hands with people who may not be our friends and allies, but I can do that. And then what happens is, like everybody else who went on vacation this summer, it seems, you come back with COVID.
You certainly do. And maybe not your luggage, based on some of the other conversations we've been having about travel.
They're good at the bags on Air Force One, however.
Oh, that's good. I want to bring in Dr. Celine Gounder, who has rushed over here. She was on the phone with us. And when she was on the phone, she was in the car trying to get here.
With your mask on. Very well done.
And Christina's hanging out with us, staying here as well. And you're going to actually enjoy her for many hours to come, because she's going to be taking over soon. But let's talk about where we're at right now. You know what? Let's revisit what we know about the president. We're told that he's going to be isolating, according to CDC guidance, that he's taking Paxlovid. So what is CDC guidance in regards to isolation? Because I don't even know anymore, because it had gone from 10 days to 5 days. If you're double vaxxed and boosted, and what will Paxlovid do for him?
I would say the CDC guidance on isolation is really confusing, and it's also problematic because staying away from other people for 5 days is clearly not enough with this variant. People are testing positive out to 10, 14 days. 10 is probably the average. And so what I would suggest in these situations is you really just rapid test every day until you have 2 negatives, maybe 12 to 24 hours apart. That's the best way to know when you're really not a danger to others.
Is it possible to get a negative one day and then go back to being positive again the next day?
There can be a little bit of wobble around the time when you are basically resolving the infection. So it is good to have 2 negatives just to be sure you're fully no longer contagious.
Because I could think I'm better, go back to work and then infect all my coworkers.
Yeah, that's the last thing you want to do.
But you know what, Dr. Gounder said something really interesting the other day to us about this particular variant and the fact that so many people are vaccinated, that sometimes people feel symptoms, they test, it comes back negative. But and then they test positive a few days later. Explain how that's working now.
So because people have immunity now, whether it's from vaccination or a prior infection, your immune system kicks into gear much earlier after the virus has, infected you. And so in those first couple days of infection in the past, you did not have symptoms. Now, because your immune system is reacting so much more quickly, you do have symptoms. And it's not to say that the tests are any better or worse than they were. We always knew a rapid test probably took about a day or 2 to turn positive as compared to a PCR test. But that really hasn't changed.
Yeah. So
what about the lack of availability for PCR tests? Because I remember when things were a bit more serious, you could get them more regularly. But if I wasn't able to get one through work, I don't know where I would get one. If you're a regular person trying to
I don't see them in the stores anymore the way I used to. Yeah.
Or where can you go to get a PCR test if you're worried the rapid might not be accurate?
It's a great question, because we had a lot of publicly funded testing sites, PCR sites. A lot of them have been dismantled. And so now you're really having to go to places like your urgent care center, your local hospital for that kind of testing. And it's certainly become much harder to get a PCR test than it was a couple months ago.
So we know that the president was tested last Tuesday. He tested negative, but then he went on a trip. He returned over the weekend. Based on what we know about his movements, do we have any idea when he may have contracted this?
Well, your incubation period with the Omicron variant is 2-3 days. So something that happened over the last few days. What can I say exactly what that incident was? I can't say.
I mean, is it also possible, and we try to stay away from speculation, but when you go on these trips, I mean, even on that plane, there are so many people, right? There's the Air Force flight crew, there's the reporters. Now, it's kind of segmented, and the reporters are in one section, a lot of the staff is in another section. But you have to think if someone on that plane got it who then passed it off to someone else, the White House guys, is much smaller than it looks on TV, and everybody's in each other's space all the time. So, I mean, would it be possible to have gotten it from even a staffer who was on the trip?
Oh, absolutely. And as you say, they work in very close quarters in the White House. They really are one on top of the other. And so if somebody does have COVID, the risk is pretty significant.
The president is taking Paxlovid. Major Garrett said it was transformative for him. Any symptoms he was feeling, they disappeared right away. Tell us how Paxlovid works, and what is the availability for this drug now?
So Paxlovid is a pill. It's an antiviral pill, and it works by blocking the replication of the virus. And then your immune system has a chance to better kick in and clear the virus. It helps people stay out of the hospital, especially older people. That's really where we've seen the impact. So it makes a lot of sense that the president was started on Paxlovid. I would have done the same if I were caring for him. And, I think big picture, stepping back, we're in a very different place than when former President Trump got COVID. That was before we had vaccines. It was before we had Paxlovid. So it's just a very different scenario.
I remember, sort of the original COVID. There was kind of a pattern to the way people felt, that they would get sick, and then they would feel better, and then they could get really sick. Are we seeing something similar? And kind of like, the real question is, could we see the president get sicker than he is right now?
Well, there is sort of two phases to the illness. The initial phase is when the virus is replicating. And when people often get really sick is when your immune system is responding, but it's responding in this dysfunctional, hyper-inflammatory way. So it's actually the immune system response that's causing a lot of that disease. That usually kicks in maybe a week or more into the infection. So, he does need to be monitored closely. So far as we know, he's not requiring oxygen, which would be a key symptom sign of deterioration. But I'm sure everybody's going to be keeping a very close eye on it.
And is there a point at this progression where you're the most contagious? Like if we're looking for even a small outbreak among White House staff, should we be expecting that soon? Should we be expecting it in a few days? Like, what should we be watching for?
I would expect it within the next 2 to 3 days. It's at the beginning of your infection when you're most infectious. He's now been started on Paxlovid, so that's also going to help bring down the viral levels. So I think, in the next couple days, we'll have a pretty good sense of whether contact tracing is picking anybody else up.
And we heard that Dr. Jill Biden, the First Lady, has tested negative. She's going to continue on her schedule, and she's pretty busy. How do you feel about that? Is that a good idea?
If she's masking and she's wearing a high-quality mask, a KN95 mask or an N95 mask, so if she's masking when she's indoors with other people, if she's testing at least once a day to make sure that she doesn't turn positive, I think that's okay. But she really does need to be wearing a mask.
Okay, so we have actually Bo Erickson still standing by for us, and he's been sort of collecting information at the White House, whatever he gets. And Bo, as I understand, you have a little more information about just when the First Lady and the President were in contact with each other.
Yes, so the last contact between POTUS and FOTUS was yesterday morning. And the reason why it's been about 24 hours is because the First Lady went off to travel to Connecticut. And then later on, the president went on to travel to Massachusetts yesterday. So that's their last contact. And it's just important to note, I just confirmed this again with the First Lady spokesperson. First Lady Jill Biden has not had COVID yet. She's not tested positive through these past 2 or some years of the pandemic. She is vaccinated twice and boosted. And so we know that she's going to continue her schedule today in Michigan. Then she's traveling to Georgia. And then tonight she will go to her home in Wilmington, Delaware. So she will be apart from the president. It is unsure if how long she will be apart from the president. I also asked her spokesperson if any of the Biden family has been tested hasn't tested yet, and we do not have any more details on those, so we're going to keep asking.
All right, Bo, thank you very much. You asked about the possibility of sort of spread throughout the White House, and then it reminds me of Amy Coney Barrett's when she was confirmed, and it was an outdoor event, very nice weather, as I recall, but a different time for the nation when it comes to COVID, and it became basically a super spreader event.
The thing about DC is it really is a small town and everybody goes to all the same events. So we saw it at this Amy Coney Barrett Rose Garden, again, outdoor press conference. And I think it was the New York Times did a graphic where they were just checking off the people in the first 2 rows who'd all announced, senators, members of Congress, the judiciary, they'd all come down with it. But you kind of see these spikes in D.C. anytime there's big events. In the spring, we have, the Correspondents' Dinner, the Gridiron Dinner. And again, even anecdotally, you see all these people coming down with it. And it's because it's such a company town where people who work at the White House also go to the same restaurants, who also talk to people on the Hill. I mean, that's how the government works, is all these different agencies are always talking to each other. In normal times, that's something you want. But in COVID times, it can make it so easy to spread it. I mean, even among CBS News employees, our colleagues at other networks, we can see one person gets it and you can just follow it tracing around the town because everybody knows. And, the other really scary thing is when we were traveling with the Secretary of State, for a while there, if you were on the plane and you got COVID, because we test with the secretary, you land in different countries, the president too. Yeah. And for a while you were testing before you landed, when you landed, and when you exited a country. So we were sometimes getting 4 PCR tests in a day, like my nasal passages were dying. But if you tested positive in one of those countries, you then got stuck in one of those countries and had to quarantine there. So there was an incident on a trip to Asia where one of the flight crew had it, and then one of the other photographers had it, and he had to spend 2 weeks in a quarantine in Asia, and it was like right up against Christmas. So that was the kind of risk that you put up, but nobody is really doing that in DC anymore. As we went back to the 5-day quarantine, the 10-day quarantine, at least to me, it seems really unclear what the different rules are, even at the different agencies, even among the different companies, different media outlets. Like, I know we have our rules, but what is the White House rule? What is the Pentagon rule? What is the State Department rule? And it's a city of workaholics. And frankly, people are sneaking into the office as soon as they're feeling better because sometimes they've got stuff to do.
What you're bringing up is, I think, what is happening kind of across the country. Doctor, you can speak to this a little because it's here as well. Even within CBS, that we have multiple buildings where broadcasts come out of, and there are different rules depending on the building that you go to, right? And so you may be very, very sort of stringent about masking up in one building because you can't work if you don't mask up, and then you go to another building to do the rest of your job, and it's a free for all.
Like in DC, I test to go into the bureau, but I don't to go into my office at the State Department,
there
right?
You go.
So
yeah. So, Doctor, sort of, you're seeing this very contagious subvariant kind of spread across the country. What are your thoughts on just the way we are adapting or not adapting?
We are in a really, I think, difficult situation because we are seeing this virus spread across the country. We have many people who've been vaccinated, who've been boosted. We have some people who have some immunity from prior infection, and yet we are still seeing people getting infected. The people who are landing in the hospital are people who have not been vaccinated by and large. And, remembering that most people have actually been exposed to COVID, that actually attests to the fact that infection does not give you very good immunity. These people are getting sick enough to land in the hospital. But I think, people are really frustrated. They don't know what's to come. Are we going to have endless cycles of boosters? That's not going to be a sustainable public health strategy. And when will we have a universal coronavirus vaccine, which would really be the holy grail that would protect us against all the variants? We're still a few years off from that.
Is that something they're working on?
They are. There are some candidates in the works, but there's not an Operation Warp Speed for this. And that's really what you would need to have the resources marshaled to really expedite this kind of research and development.
Do you think the federal government did a disservice with all this mixed messaging coming from the CDC? Wear a mask, don't wear a mask, like quarantine for 10 days, quarantine for 5 days. I was manic about this at the start of it. I followed all the rules. I didn't see my parents for a year and a half because my brother also works in news. We were out covering protests and events, and we just didn't feel like it was safe. But then even I, who, is a goody two-shoes and wants to follow the rules, I'm getting frustrated, and I don't feel like if half the country is not doing it or 2/3 of the country is doing it, why should the rest of us? Does it help at all for me to put on a mask in a train car where no one else is wearing one?
And I think there's also, what you're just describing too is a little bit, I'll be honest, a little bit of social pressure that you walk into a room and no one else is wearing a mask, and then, slowly you wonder if you're overreacting.
I'm the biggest chicken in, whatever restaurant I'm in. Yeah.
Right.
Just because people around you are not wearing a mask does not mean you can't. You don't need to be mandated to make that choice. And we do know if you wear a high-quality mask, a KN95 or an N95 mask, it will protect you. against infection by other people, regardless of what other people are doing.
So even if everybody around me doesn't have one, if I have one on, it's still making a difference for me.
It's making a difference for you. So I think that's a really important point for people to understand. In terms of mixed messaging, I think one of the other key areas where CDC and the administration, I think, was overconfident is with the vaccine and what the vaccines could accomplish. These vaccines are designed to prevent severe disease, hospitalization, and death. They're not designed to prevent all infection and transmission. So you have to layer other protections in addition to the vaccines in order to prevent infection, and that means wearing a mask a lot of the time.
When we were talking about these vaccines, I mean, time is so weird during COVID, but I think it was about a year ago, right, when we really started rolling them out. Were they expecting people to get reinfected this many times? Were they expecting to have second and third boosters? I mean, I know people who've gotten every flavor of COVID, the first variant, the second variant, the third and the fourth. I mean, was that part of the process, or is that a bit of a surprise?
I think that's been a surprise. I think we've been surprised by how quickly the virus is mutating, how quickly new variants are emerging. It seems like, at least right now, if this is predictive of the future, we'll have a new significant variant emerge every once or twice a year. And will that mean that you need to update the vaccines once or twice a year? We don't know. Again, a universal coronavirus vaccine that would be effective against all variants would get us out of that bind. But I don't think we anticipated that we would end up in this cycle of boosters.
You know what I think about, too, is not necessarily contracting COVID, but my big concern is long COVID, because we know such little about it. You have a very demanding job. I got these crazy hours, and I just think like I'm just on the edge here. I don't think I could endure long COVID and maintain this pace. And then I think of the president, who also clearly has a demanding job, who is, 79. What do we know about long COVID? Who's more susceptible to get it? Because as I understand it, you don't necessarily have to have a bad bout of COVID to wind up getting long COVID too.
It does seem like people who have some of the same risk factors for severe COVID, so things like diabetes or obesity, do seem to be risk factors for long COVID as well. It is really disabling. I have colleagues who are physicians who got long COVID after an infection and who are still having trouble, like that brain fog, being able to concentrate, being able to remember. It can really be a problem if you have a job where you have to be truly high functioning every day.
And what qualifies as long COVID? Because allegedly, I've never tested positive for COVID. I mean, allegedly, I've never had it because I've never gotten a positive test. But when I was overseas in Poland, I got really, really sick for a couple days. I tested negative. I kept working. But like a month out, I still didn't feel like I was awake. I still didn't feel like I had lung capacity. So how do you diagnose that as long COVID? How do you know if it's long COVID or it's just because we work all the time and we're tired and, life is a little tough right now? How are you figuring out what long COVID is in certain patients?
Yeah, we still don't have a test. Ideally, you would be able to say, if you test positive for this, that means you have long COVID. We don't have anything like that yet. The NIH has a large trial that will help, hopefully, give us some of what we call these biomarkers that would let us test you. But right now, it's really based on symptoms, and are you still having these symptoms a couple months out from your original infection? A month out does not necessarily qualify as long COVID. In fact, a lot of people a month out from their infection with COVID will still have that shortness of breath, that brain fog, sometimes some GI symptoms. That's really not uncommon.
I mean, but so back to Anne-Marie's question, if you're the president, and you're sick for a month or longer, is that going to impact your capacity to do your job?
I guess we'll have to wait and see. What we're hearing right now is his symptoms are really mild. We don't know if he's going to develop long COVID, hopefully not. We do know vaccination does seem to reduce the risk of developing long COVID, and he's been twice vaccinated plus twice boosted, so 4 doses in all. So we're hoping that plus the Paxlovid will really insulate him from that.
Listen, we've been talking for a while, and we've really gotten into COVID, so we want to tell everybody about the breaking news and why we are here right now. We're talking about President Biden. He tested positive for COVID-19. Here's a roundup of what we know right now. The White House says that the president is experiencing mild symptoms. He's being treated with Paxlovid. The 79-year-old president is fully vaccinated. He has received 2 booster shots. Now, Mr. Biden traveled to Massachusetts yesterday to announce plans to take executive action on climate change. He also just got back over the weekend from a trip to the Middle East, and we are expecting to hear from White House officials in a briefing at 2 p.m.
That's right. We have team coverage on this morning on this breaking news. CBS News reporter Bo Erickson is at the White House. Chief Washington correspondent Major Garrett is with us from Washington. Reuters White House correspondent Jeff Mason, hi Jeff, is also with us. And here on set we have Dr. Celine Grounder. She's our editor at large for public health for Kaiser Health News, an infectious disease specialist and epidemiologist, all those syllables, at the NYU Grossman School of Medicine and at Bellevue Hospital.
So we wanted to jump back to Major Garrett. We were having actually a really good conversation. I want to remind people, too, that Representative Benny Thompson also tested positive. He is the chair of the Select Committee investigating the January 6th assault on the Capitol, which has a prime time hearing today. He's not going to be there. So, you know, and to that point, just how disruptive, Major, are these positive COVID tests? I mean, obviously, you know, the president says he's going to keep working, but I imagine that when there's people within his close circle who now have to be tested, who now have to keep their distance, this can kind of throw a wrench in plans.
No doubt. I've covered a lot of White Houses, and every challenge is an opportunity, or you have to view it as such. And there is a real challenge for the Biden White House in the next 48 to 72 hours. Talk to the country about what this means for the president and what it means for our national adaptation to COVID, because the key word you just used, Anne-Marie, is disruptive. Any positive test, separate from your medical reaction, meaning whatever symptoms you have or whatever interventions you take, even if you're fine, is disruptive. It's disruptive for a minimum of 5 days. It can be disruptive for 10 days. And all the issues that the country has been grappling with for the last 6 months about what are the workplace rules, how frequently do you test, all of those things are now in the lap of the White House, because they're going to have to explain to the country how the president, disrupted though he is, and the workflow of the entire White House now will be disrupted by this positive test, is going to function. That's a challenge. It's also an opportunity to say, we are dealing with risk. Here's how we evaluate that risk, and here's how we are adapting to that risk. That could be something that can be helpful to the larger country in how to assess risk, adapt to that risk, and continue to function. Because White Houses have to continue to function. And the president has to be at the top of his game as best as he possibly can be, even with this positive test. One other thing. It's worth reminding ourselves that not this July 4th rather, but Independence Day, the first year of the Biden presidency, what did the president declare? We are declaring our independence from this virus. That is an inconvenient truth. Now, in late July of his second year in office, heading toward the midterm elections, where he's contracted coronavirus, it can be definitely dealt with. Paxlovid is a reliable, at least for me and lots of other people, millions of Americans, I would guess by now, method of intervening, but still, we're not independent from this. We are adapting. And the challenge for the White House will be, how do you explain, how do you walk the country through as transparently as possible how that adaptation looks, how it functions, and how you assess and mitigate risk?
And Major, you said that the White House has to continue to function, and we have to see how this impacts that function. And with that in mind, we're going to go to Jeff Mason, who's standing by. Jeff, I hear you have some information on the vice president for us.
Yes, from a White House official to Reuters, Vice President Harris tested negative for COVID-19. I'm just going to read this out loud to you. She was last with the president on Tuesday. She spoke to the president by phone this morning, the official says, and her schedule will continue as planned. The vice president will remain masked following the advice of the White House medical team. So she's got a negative test so far. Important to note that Vice President Harris has had COVID already. It's been a few months. I can't remember exactly when that was now. So I think certainly out of the 90-day period, but she has had it previously. Both the president and the vice president, of course, have been vaccinated and boosted. I think also, just to piggyback on something that the good point that Major was making, this White House politically will certainly want to show that President Biden can continue working through this. But it's also their top priority to keep him safe and to get him well. So in the same way that the Secret Service is looking out for President Biden everywhere he goes, right now, the onus will be on his medical team and on his advisors and on the president himself to take care of himself so that this doesn't become worse than it has to be.
Jeff, do you foresee them changing the rules for entry at the White House? You know, we've been through a couple different iterations of this. you used to have to test just to get in through the gate. You know, now you only have to test if you're in the pool and you're going to be in close proximity to the president, if you're going to be traveling with him. What is your take? Do you think they're going to be tightening up the testing and the precautions on the White House grounds after this?
Good question. It's hard to say. You're right to note that the precautions have changed a little bit in that not as many people who used to have to test to get onto the property are still doing that. That said, people who are in close proximity to the president, including the pool, as you noted, but also advisors, get tested every day. I don't know if they'll change. I mean, I think that this White House has wanted to walk sort of a careful line in the last several months, if not the last year, of saying, hey, everybody, we need to take precautions on COVID. People need to get vaccinated. You need to be tested. You need to keep distance when you are sick, but also wanting to show that it is possible to live with this virus and live with this disease. So that's, you know, in terms of just the press perspective, they were eager to have the press room open again. For many months, of course, we were in a limited capacity there with 14 people. Now you'll see this afternoon at 2 p.m. that the whole briefing room will be full. My guess is they don't try to change that, in part because they want to show that this is something people can live with and continue to deal with. But the fact that the president, of course, has come down with COVID now means that they'll no doubt have to discuss whether new precautions need to be taken.
We have Nancy Cordes standing by at the White House, but I also want to talk to Major Garrett first. So Nancy, sort of stand by to what you were saying. Oh, there's Nancy. To what you were saying about, you know, the messaging that this administration has to send out. That the one area that the administration was seen as being successful was getting a handle on the pandemic. One of the areas that the president is facing a lot of criticism is the economy. We know that the primary reason we're in the situation that we're in.
These issues are supremely tied together.
Exactly. So, which brings me back to Major Garrett about that, about how challenging is this? It's not just about getting a handle on the pandemic. It's saying, are you the man to help to turn this economy around if you can't get a handle on what initiated this spiral that we're experiencing now?
Right. So when there was a conversation in Washington in March of the first year of the Biden administration around the American Rescue Plan, $2 trillion, one of the things the administration said is this money will help us deal a knockout blow to coronavirus. It will give us all sorts of interventions. It will increase the distribution of vaccines. It will pay for more testing and more testing facilities. And all of those things, all those interventions, all of this federal money will deal a knockout blow to coronavirus. That was the anticipation. That was the hope. It was well-intentioned, clearly, but it hasn't played out. A lot of other things happened. Job growth has increased dramatically. It's worth remembering that about that time, first-time claims for unemployment were running about 800,000 a month. Now we have near full employment in this country, if not full employment. Almost 8 million jobs created. I'm not a spokesperson for the White House, but that's a fact economically. And the economy's overheated with too much inflation. That's not something this administration anticipated. As a matter of fact, back again to that conversation about the American Rescue Plan, the administration at the top level said inflation might be a risk, but it's a risk worth taking because we have to get jobs created. Well, the jobs have been created, inflation's running rampant, and the administration has a definite political problem. So those two things, as Christina just said, are interwoven, and they are unhappily and uncomfortably interwoven more today than they were even yesterday.
Yeah, and I don't think we can go back. I mean, I don't know. I
just don't think the will is there anymore, even from people who had good intentions, who wanted to do the right thing. At this point, I mean, people I've talked to are just like, if I get it, I get it. I can't do this anymore. I got to go back to work. I got to see my friends. I have to leave the city I haven't left in 2 years and go get on an airplane and go somewhere.
And those words are exactly what Dr. Celine Gowder does not want to hear.
I know.
Yeah, she doesn't want to hear. But we do have Nancy Cordes, who is in the White House now. We want to take you there. So Nancy, Ed O'Keefe was talking earlier about this, that there was a sort of feeling within the White House that, listen, we might have to just prepare for this. It's, to what you're saying, that, it may be inevitable that the president, no matter what precautions we take, may test positive. Well, now it looks like it happened.
Right. I mean, if you think about it, it's pretty amazing that he hasn't gotten COVID before now. I mean, this is a person who travels all around the world. He meets with different groups of people every single day. Yes, in the beginning, the White House tried to keep a great deal of distance between him and other individuals, including his own staff, even in those small rooms where they hold their meetings. But, he's gone about 2 years without getting COVID, whereas most of us have already had it and recovered. And in fact, a lot of people I know have had it more than once. So I think what you're likely to hear from the White House officials who are holding that briefing later today, including Dr. Ashish Jha, who's the COVID coordinator here at the White House, is that the system is working the way that it should. He has mild symptoms, in part because he has been double vaccinated, double boosted, and he is now taking Paxlovid, which is likely to ensure that those symptoms remain mild. And they now have a big contact tracing job on their hands. And I know others have mentioned just yesterday, after all, he shook hands on the tarmac with 3 U.S. senators, with a couple of U.S. House members, with a governor. He was on Air Force One, on Marine One, with at least 8 White House staffers, if not more. And, anyone who's seen Marine One, that's the helicopter. You're pretty close quarters when you're on that chopper. So, they'll be going back and keeping an eye on all of those staffers. But, I think that this is emblematic of the fact that we've learned a lot about COVID in the past couple of years. We have new tools to deal with it. And, the First Lady just a few minutes ago talking to reporters said he's doing fine, he's feeling good. And I tested negative this morning and she's feeling fine as well, which is great news.
And Nancy, we have a tweet from the First Lady as well, if we can pull that back up, which basically said exactly what you just said. She's spoken to the Perigo. On the road in Detroit today, but I spoke to Joe earlier and he's feeling fine, just experienced a few mild symptoms. And again, she's saying this morning she tested negative. Nancy, I want to ask you what we were just talking to Jeff Mason of Reuters about. My first thought, selfishly, frankly, when I heard this is, oh, they're going to lock down the White House grounds. We're all going to have to start testing again. They're going to test everybody who's going to come in and out of that gate. But politically, is that something the White House can really do? Because they're making this big push to say they've made progress on COVID. They're moving forward. Are they going to be able to lock down, even if they wanted to increase the precautions only at the White House when they're asking the rest of the country to kind of move forward with their daily lives?
I don't think they can, and I don't know that they'd say that this is called for. You've heard White House officials, you've heard health officials around the country say that we are moving into an endemic phase with this virus. We're no longer in the acute phase where you have to accept the reality that there are people who are going to get COVID from time to time, and hopefully the fact that they are in many cases vaccinated and boosted is going to ensure that they have a fairly mild case. And then the people who have been around them need to take precautions, need to be aware, need to get tested so that they can, to the best of their ability, prevent the virus from spreading to others. I'm not sure that the White House wants to go back to that time a year ago, and I'm not sure that they think it's necessary to go back to that time a year ago where you had only a handful of reporters in the White House briefing room and everyone in the White House masked all the time, and the president having meetings with very limited groups of people to keep everyone safe. That was what was called for at the time, but I imagine what you'll hear Dr. Ashish Jha say from the podium today is that we're in a new phase, and the president's getting great medical care, but that his case is progressing the way that millions of Americans' cases progress now, which is that he'll isolate for as long as he needs to. He'll get obviously fantastic medical care, and then hopefully he'll head back to work, no harm done.
Nancy, thank you so much. I know you're busy and we got to let you go, but we appreciate you coming in here to talk to us from the White House. Thank you.
You got it.
Dr. Celine Gounder is also here, and I wanted to ask you about something that we were talking about a little bit earlier, whether or not the federal government has what it needs to ensure that we don't see another dangerous surge. We know that we have a very highly contagious variant. The president has been asking for more money when it comes to COVID resources. Actually, more specifically, my question is, the president wants more money for COVID resources. It doesn't look like he's going to be getting it. Where should the money that we have go to protect us?
What little money is being shifted around is being shifted around really to emphasize vaccination. So vaccination with boosters right now, the updated boosters in the fall. The problem is that alone is not enough. We've had this very vaccine-centered, centric approach to controlling the pandemic. And yes, the vaccines are doing a great job of keeping people out of the hospital, not dying. But there are other things we do need to be doing. So, for example, surveillance. Where, when are these new variants popping up? We've dismantled a lot of that surveillance, not just in the US, but around the world. And so that means we don't have that radar, so to speak, to know when these things are happening, to react to them or be proactive when it's still very early. Those are the kinds of tools. I mentioned the universal coronavirus vaccine. That would be the holy grail, something that protects you against all variants. But there's not additional funding to really expedite that kind of research and development right now.
Because COVID fatigue isn't just masks and social distancing, it's also legislative. And if it's not on the top minds of voters, voters are not talking about COVID anymore. And that when you ask them to rank in all these surveys what they're most looking for when they vote in November, it's the economy, it's the economy, it's the economy, it's inflation, it's gas prices, it's not COVID anymore. And so that's going to be hard to get, legislators to pay attention to that.
I think that's such a great point. And even though we talked earlier about how, the state of the economy is still directly connected to the pandemic, right? Because there are all sorts of, issues both domestically and overseas that's limiting our access to products. It's forcing, these products, the prices to go up. That's not what the public sees anymore, or at least feels anymore. Now, it seems like there's an association between inflation and and the price of gas and maybe what's happening in Ukraine and Russia, but also the present administration. And what are you going to do about this inflation? And what are you going to do about interest rates going up? And you're right, we have midterm elections around the corner. It just doesn't sell.
Not at the moment, it doesn't seem to. So what can medical professionals do to convince voters, to convince lawmakers, to convince these people, if anything, they need to still fund this? This is not something, it's like a fire department, right? You can't only pay the fire department when there's a fire they need to put out. You have to pay them all the time.
Right.
And I know that's something the medical industry struggles with. But what do people need to know about this that will put it at the top of their mind?
Well, if anything, this pandemic should have shown people the importance of public health and why you need to be funding public health departments, why you need to have labs that can do this kind of surveillance and testing, why it's a problem to have just fax machines to send data around to the CDC, why we need to have 21st century tech data systems, why we need a way to expedite things like drug development and vaccines in the context of a pandemic. These are all things that require investment. And we have really underinvested in public health for decades now. Had some significant cuts around the 2008-2009 recession, and we have never in public health recovered from that.
Why is that? And why even now? Did we not just learn this lesson? Why are memories so short when it comes to public health?
We're still in the middle of the lesson.
Correct. See, even I'm getting it wrong. Correct.
This is a situation we see with public health over and over. It's these boom bust cycles where you put in lots of money. Ebola, the same thing happens. Zika, the same thing happened. Put in a lot of money in the middle of the crisis and then immediately forget. We in the public health community, we in the medical community, we know what the lessons are from COVID. The problem is you need funding, you need resources, you need manpower to actually act on those lessons. And we still haven't seen the necessary resources marshaled to do that.
And Christine, that's why your comparison was so good about the fire department, is literally putting out a fire and then dismantling the fire department, And
this is not something that's specific to public health, but it seems, based on what we've learned the last couple of months, as you were saying, it seems to be really exacerbated in the public health field because I guess if you're feeling good, you just don't want to think about it.
Yeah, and maybe that's it. So let's just sort of reset so people know exactly what we're talking about. The president has tested positive for COVID. He is double vaxxed. He is boosted. He is experiencing mild symptoms, and he is undergoing treatment with Paxlovid, which, as we understand it, is sort of CDC protocol. And he's also going to be isolating, Doctor.
That's right. So he should be isolating. The CDC guidance would be that after 5 days, you could come out of isolation. You should still be wearing a mask. But what we're seeing with this variant is, on average, people take about 10 days to turn negative, some people out to 14 days. What I'm advising people is to really go by the rapid test to figure out when that turns negative, 2 in a row. That's when you can safely come out of isolation and you're no longer contagious to other people.
And just a reminder, the rapid test is testing for what versus the PCR test?
The PCR test is checking for the genetic material of the virus, and that can actually linger for weeks in some people, even after you have gotten over that case of COVID. The rapid at-home tests that people are using that you buy at the pharmacy, those are testing for protein. And you're not going to have protein unless the virus is actively replicating, and that's when you're contagious.
Now, the First Lady has said she's talked to the president. He's feeling good, experiencing only mild symptoms. She's also continuing on with her travel today. We did see her wearing a mask, and she said she's tested negative. What do we think about that? Is that a safe thing for her to be doing?
If she is wearing a high-quality mask, so an N95 mask or a KN95 mask, when she's indoors around other people, that would really limit, if she were to come down with COVID, that would really limit the risk for other people to get COVID. So I think that would be a reasonable way to handle the situation. And then, if she's outdoors, your risk of transmitting the virus to other people is really exceedingly low.
Is there a possibility of lag time that, obviously she was with her husband. She hasn't been with her husband for 24 hours, but have you seen situations where people are in close contact, one person tests positive, and it takes a while for the other one to test positive if they do?
Well, everyone's a little bit different. So they could have had the same exposure, and she's just taking a little longer to turn positive on the test. It's also possible he got it first, and then he transmits to her, and then she turns positive a couple days later. It's a little hard to sort that out sometimes.
And it's possible that she's never going to test positive, despite her close contact with her husband.
That's right. It's not 100% of the time that you're around somebody who's contagious that you're going to get it. So it's certainly possible she won't get it at all.
Wow. Okay, so we've had plenty of people helping us out with this breaking news that the president has tested positive, but he is for COVID. He is undergoing treatment. He's got mild symptoms. He's isolating. And we want to thank everyone who joined us this morning, including Dr. Celine Gowner, Major Garrett, Nancy Cordes, who had to run, Ed O'Keefe, who had to run, Jeff Mason. This is truly team coverage. And Bo Erickson and Caitlin Huey-Burns, who also had to run. Thank you so much. We're going to take a break now, but our coverage of the president's COVID diagnosis is going to continue in just a few minutes.
And Elaine Quijano will be joining me on set, and we'll be hearing from doctors as well as our team of political correspondents. We will also, of course, bringing you a live update from White House officials. That's due around 2 p.m. Eastern. Stay with us. You're streaming CBS News.
I'm Nora O'Donnell with the CBS Evening News.
Peter Van Sant with CBS News.
Jonathan Vigliotti with CBS News.
This area is still getting shelled.
I've covered 5 towns destroyed by fire.
Bombshell testimony today. We were watching the Capitol building get defaced over a lie.
If we can't talk about it and we can't make changes, when can we talk about it?
It was close.
We wish you all the luck in the world.
Are you willing to get involved militarily to defend Taiwan if it comes to that?
Yes.
You are.
You ain't seen nothing yet.
What up? All hail the Queen.
Energetic on a Saturday morning, right? All right.
Get ready.
Wow.
Keep watching. You ain't seen nothing yet. Agree that bigger, better. You ain't seen nothing yet.
Stream us anytime on the CBS News app.
You ain't seen nothing yet.
You ready?
A generation of kids opens up on CBS Reports.
I just want to be like a regular kid.
Their world, their struggles, their voices.
What if I was white?
A lot of people like to call names and make you feel ashamed for being proud of who you are.
Now streaming the internet.
Technology is baked into the DNA of our generation.
Social media, apps, and games.
I like my iPad, my phone, my Nintendo.
Instagram, TikTok, Twitter, it's one click away.
Is growing up digital a blessing or a curse?
There is so much pressure to be perfect.
We need to have conversations regarding healthier usage.
Are the kids all right? The internet, now streaming on the free CBS News app.
When weather is about to get extreme.
We're talking about hail, we're talking about tornadoes, damaging winds.
Every second counts.
Let's now take a look at what that really means to you.
That's why CBS News and the Weather Channel have come together to bring you virtual weather technology so advanced, so real.
We can show you what it's going to look like when the storms come through.
You'll see what will happen, where it will happen, before it does. Feel the forecast on CBS News. Time to get prepared.
I'm Nora O'Donnell in our nation's capital. We're here at the White House with the President of the United States.
Thanks for having me. I appreciate it.
We've never done an interview like this before.
That's correct.
Tonight, a congressional investigation sparked by reporting from CBS News.
What's your message to consumers?
They need help now. Tell him I feel it.
The CBS Evening News with Nora O'Donnell from Washington, D.C. on CBS and streaming on Paramount Plus.
We will witness yet another moment in history.
We have an inspiring story that started with a strange act of kindness.
Yeah. We found it. You're kidding me?
We got it. We share stories that lift you up and brighten your day.
The Uplift. Stream on the free CBS News app.
If it's important to our nation,
What happened? This country was supposed to be at a moment of reckoning.
it's on Face the Nation.
Senator Scott says he's at the table. Will you come back to it?
Making politics make sense.
Aren't you playing politics with national security?
The why behind the biggest stories.
Are we going to see a hot war in Europe?
Face the Nation with Margaret Brennan on CBS.
I'm Nora O'Donnell with the CBS Evening News.
Peter Van Sant with CBS News.
Jonathan Vigliotti with CBS News.
This area is still getting shelled.
I've covered 5 towns destroyed by fire.
Bombshell testimony today.
We were watching the Capitol building get defaced over a lie.
If we can't talk about it and we can't make changes, when can we talk about it?
It was close.
We wish you all the luck in the world.
Are you willing to get involved militarily to defend Taiwan if it comes to that?
Yes.
You are.
You ain't seen nothing yet.
All hail the Queen.
Energetic on a Saturday morning, right? All right.
Get ready.
Wow.
Keep watching. You ain't seen nothing yet. Agree that bigger, better. You ain't seen nothing yet.
Stream us anytime on the CBS News app.
You ain't seen nothing yet.
Hello, everyone. Thanks for joining us here on CBS News. I'm Christina Ruffini.
And I'm Elaine Quijano. We are beginning with breaking news.
President Joe Biden has tested positive for COVID-19.
The White House says Mr. Biden, who is fully vaccinated and twice boosted, tested positive this morning. We're told he will isolate at the White House and continue to work from home until he tests negative. The White House doctor says the president's symptoms are mild. He went to bed feeling fine, but had trouble sleeping and tested positive this morning. We are starting with CBS News. Chief White House correspondent Nancy Cordes is joining us now from the White House. So, Nancy, what are you hearing about how the president is doing and how he's being treated?
Hello, Elaine. Hello, Christina. The latest we're hearing from White House officials is that the president has mild symptoms, as you mentioned. He woke up this morning tired, runny nose, dry cough. They said he went to bed feeling fine, but didn't sleep that well, and then woke up with these mild symptoms, was tested, and he was positive. Very soon thereafter, he was put on that 5-day course of Paxlovid, the antiviral, and at this point, he is working, isolating in the White House residence. His wife, the First Lady, we're told, hasn't seen him since yesterday morning because she has been traveling separately. She's actually in Michigan today, where she told reporters that she has spoken to the president, that he is feeling fine, that she's feeling fine, and that she's going to continue with her schedule. She's going to be in Georgia today. She's supposed to overnight in their hometown of Wilmington, Delaware, and then presumably will continue to stay there for some time so that the two aren't in close quarters. Up in the air is the president's schedule next week. He was supposed to go to Orlando on Monday for a crime event to meet with law enforcement officials there. Clearly, that's unlikely to happen, and depending on when he tests positive and when he starts to test negative, will determine whether he's able to get back to a more normal schedule with meetings sometime soon.
And Nancy, do we know who the president has been in close contact with, either at the White House or Capitol Hill, or, he's been traveling recently? Who are those people? Are they quarantining? And what are the precautions at the White House?
He has been around a lot of people in the past 48 hours or so. Whether or not the White House doctors are going to end up considering all of them close contacts remains to be seen. You know, there have been a number of times in the past when a White House official has tested positive and has announced it, but then the White House will tell us that the president himself wasn't considered a close contact, even though we know that that White House official met with the president. But if they weren't sitting very close together, if they were masked, if they were together less than 15 minutes, then the White House will determine that actually they weren't close contacts. So we're still waiting for that official determination. But we do know that yesterday, for instance, he was on Marine One and on Air Force One with at least 8 White House officials. We saw them with him, particularly when you're on Marine One. You're in pretty close quarters, and these White House officials and the president don't tend to wear masks nearly as much as they used to. When he got to Massachusetts and Rhode Island, he got off of Air Force One. He shook hands with the governor of Rhode Island. He shook hands with 3 U.S. senators, a couple of House members. And the day before that, we saw him with the First Lady of Ukraine. So he was only with her for a few minutes. They were outside. Probably unlikely that she'll be designated a close contact of the president, but we'll still have to wait and see and hopefully get more answers in this briefing that we are expecting from Dr. Ashish Jha, the White House COVID coordinator, in a couple of hours.
And Nancy, in addition to that domestic travel, there was also recently travel to the Middle East. Can you talk to us a little bit about what we saw there with respect to the president and his meetings, how close he was to other officials, and whether or not masking was something that we saw him do while on that trip?
He was not always masked, and he was surrounded by world leaders, particularly Arab leaders in Saudi Arabia over the weekend. The White House said before he went that he was mostly going to try to fist bump leaders in Israel and Saudi Arabia to cut down on the risk of COVID transmission. That was also most likely an attempt to cut down on the risk of embarrassment from shaking the hand of Mohammed bin Salman, the Crown Prince of Saudi Arabia, who the president in the past has said should be considered a pariah. Nevertheless, he didn't shake quite as many hands as usual, but as you can see there, he was surrounded by officials. Now, that was, that was on Saturday, so we're talking about 5 days ago now. Not out of the realm of possibility that he could have become infected there in Saudi Arabia, but more likely, I think doctors would say, it has probably happened sometime in the last several days when he has been here stateside. But obviously, pinpointing where exactly he got it, as it is for all of us, is probably pretty complicated for him as well.
And Nancy, I heard you mention earlier that it's kind of a miracle he hasn't gotten it previously. And frankly, I thought the same thing because, you know, you've covered Senator Biden and Vice President Biden and President Biden. And this is a man who really likes to get in the crowd. I mean, I have this memory of one of the dinners from back in the day when he was the guest speaker and he jumped off the stage and spent about an hour shaking hands and taking photos with people. That's something he's not really been able to do. And now they're finally easing him back into that. And this happens. Right. Do you expect to see them curtailing physical access to the president, at least for the next couple months?
Not only does he like to be around a lot of people, Christina, but probably to the chagrin of a lot of his doctors, he's a close talker. You know, he really likes to get in there with people. Sometimes you'll see those pictures of him forehead to forehead with individuals when he's trying to comfort them, someone who has experienced a loss, who has come to him to talk about that loss. You'll see him with his arms around individuals that he meets either out on the road or here at the White House. He's somebody who likes to be around people and to get close to them. And as we know, the closer you are to people, the more likely it is that if they have COVID, they can transmit it. Now, when people come here to the White House to visit him, they do have to get tested, especially if they're going to be in close quarters with the president and be inside. But as we also know, you can test negative 1 hour and then test positive a couple hours later, and you'll have had that underlying infection that wasn't detected at the time. So, yes, there are any number of places the president could have gotten it. He actually had a light public schedule on Monday and Tuesday when he got back from Saudi Arabia, but that doesn't mean mean that he wasn't meeting with any number of administration officials, White House officials, meetings that didn't necessarily end up on the public schedule, that weren't open to reporters like myself, but that nevertheless were taking place as White House officials debriefed him on everything that had taken place in Israel and in Saudi Arabia, and also domestic issues that he may have needed to catch up on after 5 days abroad.
That's right. A late day for the president is still a pretty busy day for the rest of us. Nancy, if you could hold on for just a second, let's bring in CBS News Chief Washington correspondent Major Garrett. Major, now there's precedent for an American president getting COVID. Of course, I'm talking about former President Trump, who tested positive on October 5th, 2020. That was before vaccines, and it was much more serious. And as we mentioned earlier, I was outside Walter Reed, and people were very stressed out. People were very concerned. When you look back, what stands out to you from that time versus what we're seeing this go around?
Very different times. The virus is a very different animal medically than it was then, and a very different approach between administrations. The Trump administration had kind of an ideological hesitancy to believe that COVID was as threatening and as dangerous as many public health officials suggested at the time. And their attitudes and protocols reflected that casualness. President Trump contracted the virus nevertheless, because the virus, as we have learned, cares nothing about ideology or political party, and the president was very sick, much sicker than it was publicly released at the time. He tried a vigorous comeback from COVID, but he received a tremendous number of medical interventions at Walter Reed, had to go there, was hospitalized, had oxygen deficit that was worrisome to White House physicians. All of that transpired then. Now we're in a situation where President Biden, twice vaccinated, twice boosted, manageable, mild symptoms. Paxlovid is an intervention that works for millions of Americans already to deal with this subvariant, but nevertheless contracted the virus. And from my perspective, and I think from a lot of people who cover the White House, the Biden administration has three challenges in front of it immediately. One is a medical challenge. Make sure the president is healthy and gets back to full health as soon as possible. It has a management challenge. Even if you're not really sick with COVID, a positive test is disruptive. Why? Because you have to isolate. And isolating a president from senior advisors is suboptimal, to put it mildly. It's very difficult to run a White House under the best of circumstances, but not meeting with people, not seeing the president's own attitude about issues and hard questions personally is difficult for senior White House advisors. That connectivity really matters. That's not going to be possible for at least 5 days, possibly longer. The last challenge of the three is political. Back on July 4th of last year, the president declared our national independence from COVID. That hasn't played out. He has inflation, crime, immigration, general unhappiness with the direction of the country. The only area in which his administration, in survey after survey, had a net positive assessment from the American public was management and dealing with COVID. That's going to take a hit now, and the White House is going to have to explain how, after so much time, so much intervention, so much federal dollars, COVID is still with us, and how to assess the risks and how to practically mitigate those risks and try to stay at work. Because if there's any employee in the United States who needs to stay at work, it's the President of the United States.
So, Major, on that exact point, how challenging politically has this issue been, and will this issue now be for a president who, as you note, has tried to strike this balance between projecting this notion of having a semblance of control over what is happening with this virus, and at the same time wanting to have the country open back up for many reasons, including economic reasons, and get to some level of a normality again. Just how difficult a challenge has that been?
It's been a big challenge, and one of the things that's going to confront the White House this week is, how do you function? How does a White House function, the most important workplace in America, function with the president testing positive? How does that isolation work? How do you mitigate the risk? And how do you continue working? That's a conversation going on in every office, large and small and medium-sized in this country, has been for months. The White House is now going to have to wade into that conversation and wade into it aggressively and transparently, explaining just how this is going to work. and how you're going to deal with the medical issues of the president, but also deal with the functional day-to-day, hour-to-hour obligations of the presidency. And one of the things, as Nancy alluded to a moment ago, is probably going to come from this White House is we can do this. Why? Because the president is vaccinated and boosted. Everyone who works with him is vaccinated and boosted. All right, so what does that mean to workplaces where that's also true? Can we think about our risks and mitigation and adaptation differently now? And is the White House going to be part of that new conversation that's maybe less fearful but cautious about COVID in terms of its management and application of getting work done, even though someone in a very important position tests positive? That's going to be the challenge for the White House, and how it meets that challenge will have a very great impact on the political ramifications and assessment of this moment.
Major, I mean, that's an interesting point, because it seems to me this could almost work out in, I don't want to say to their advantage, but it may not be necessarily a negative thing to say, look, everybody in America is dealing with this. We've dealt with this. We've covered each other's shifts when people are out for COVID. It's just a thing that is happening now at work, right?
How you do
exactly. Like, this is something we're all going to have to grapple with. The White House is no exception from that. The president is no exception from that. Here's the best way to do it. Now, the other end of that is they could not do that so well. Major, how do you think this is going to play out?
Look, I've learned, everyone who's tested positive for COVID has learned how disruptive it is to your life. It's disruptive to your work life. It's disruptive to your personal life. People either have to move out of the house or move to a different place if your house is big enough, but it's disruptive. That is the biggest truism and constant of COVID. It's disruptiveness, even if you don't get really sick. And if you get really sick, of course, the level of disruption is even higher. Again, the first order of business for the White House, the medical intervention, make sure the president doesn't get sick or sicker than he currently is. That's number one. But right after that is, how do you manage this? And the next thing is, because the politics always chases the White House, regardless of who the occupant is, how do you explain how that management process works? How do you deal with the disruption? Every workplace is trying to figure out that question right now, because losing vital employees for 5, 10, maybe longer days, depending how long you test positive, is a serious functional issue. Well, guess what? The biggest, most important workplace in America is now going to have to explain how that process works. I don't know how they're going to do it, but I know a lot of people are going to be watching and listening carefully to this management explanation about risk, mitigation, and adaptation. It's a big challenge. Whether they meet it or not, the public will decide.
It's the reality of the times that we are living in. Major Garrett, Major, thank you so much. And Major, will have much more on this and the January 6th hearing tonight on Red and Blue.
And Dr. Celine Gounder joins us now. She is editor-at-large for public health at Kaiser Health News and an infectious disease specialist and epidemiologist, lots of qualifications. Look, the president is vaccinated. He's double boosted. The White House says he's only experiencing mild symptoms. What sort of treatment should and will he be getting at this point?
So he's older. He's elderly, so he definitely should be started on Paxlovid, as he has been.
And for those of us who don't remember or may not be sure,
Paxlovid is a pill. It's an antiviral pill. It basically stops the replication of the virus, and it gives you time for your immune system to kick in and clear the virus. We have seen that Paxlovid keeps people out of the hospital. So it's really important that he was started on that in addition to his 4 doses of vaccine. We have not heard anything about him being short of breath, about him needing oxygen. Those would be some signs that he might need more aggressive treatment, things like steroids or monoclonal antibodies. We haven't seen anything that would point to needing more aggressive treatment.
I was going to ask, there's so much uncertainty, obviously, at this point, so much is unknown, right? But I think this is the question a lot of folks are wondering is, given what we know about COVID, given what we know about his advanced age, is there any way to tell what direction this particular case that the president has might go in?
It's really hard to predict. Now, he does not have any of the risk factors for severe COVID, so that's in his favor. He's not obese, he doesn't have diabetes, high blood pressure, heart disease. Those are some of the things that we worry about. He's gotten 4 doses of vaccine, so he's very well protected from that end of things, and he's now on Paxlovid. So I think the risk has really been mitigated very well. They will be checking his vital signs daily, I'm sure, at least a couple times a day, to make sure his oxygen levels remain high.
Now, the president always has a busy schedule, but he had a very busy schedule yesterday and was seen multiple times without a mask. How concerned are you about him having spread COVID to others? And do you think maybe the White House masking policy should be changed?
It is certainly possible, if he was indoors with other people for an extended period of time, that he could have spread the virus to other people. think it's important to remember, though, if you're outdoors, your risk of transmission is exceedingly low. Now, in terms of White House policies, I think they really, as you were saying earlier, they have an opportunity to role model. How do you deal with something like this? Because this is something every workplace is going to have to deal with. What do you do when somebody has COVID? I think it's become too much of a binary conversation. Lockdowns versus a virus free-for-all. There's something in between. And I think a lot of us would love to be able to get back into a time machine, to go back to 2019. That's not the reality, okay? We are going to have to live with COVID, but we can also adapt and make use of these tools, decide when to scale up, scale down the use of these tools, like masking, for example.
Well, one of the things I never realized before this, in Asia, they've been wearing masks when they get sick for a very long time, and I never really got it. I always thought the person wearing the mask was worried about other people. But one of the things we've learned is that if you're not feeling well, you can put on a mask to protect people around you. And frankly, that made me feel a lot better. Now I do it, like if I have a runny nose and I'm going to the store, I'll throw one on just to make sure I don't get other people sick. Is that like a shift change that we could work on a little bit, and that the messaging could work on a little bit?
I think we could. I think we could try to get people to think, that's the polite thing to do. If I am sick, I don't want to get other people sick, I will wear a mask when I'm sick. I think we could also move to a system where, just like you take an umbrella when it's going to rain, you see on the weather report, to having on the weather report, today is a high, COVID risk day. Today you might want to bring a mask with you.
Or if you're going to take public transportation, or if you're going to be inside, just throw it in your bag.
That's right. That's right.
So, the thing I wonder about is that there may be some people who see this, though, and point to the fact that the president, especially early on, made it really kind of clear that they were taking every precaution necessary. They were holding these Zoom meetings in these kind of very, before the cameras in a very public way, and having the masks on. And then, as Nancy mentioned, we saw things relax. We saw, for instance, in Saudi Arabia, that image. And I wonder, Doctor, what you think when you see an image like that. The President of the United States sitting in a room without a mask with many other people without masks.
It's always a scramble to get in those rooms, right? Because every staffer wants their picture taken, every official, every wife, everybody's always trying to get in those images.
So what do you think, as a public health official, the message might be? You talk about role modeling, perhaps, but other people may look at it and go, well, if the President of the United States, who took precautions, went ahead and did these precautions and got COVID anyway, then why should I bother?
I think it depends on what kind of testing was happening there. For example, this morning, before I went on CBS Mornings, I got a PCR test. It was negative. So you can be around people in that kind of setting without a mask indoors and feel safe if you have that kind of testing. I don't know if they were testing in that way. If everybody in the room was tested, if they all tested negative, I actually don't have an issue with it.
So you think, though, there is an opportunity here for people to look at what the White House is going to do from this moment forward. It's sort of a teachable moment, you're saying, for public health officials to kind of model for other organizations. There is the ability to live with this, because that's not necessarily a message that we've heard very clearly necessarily in the past.
Right. We don't have to go to back to Zoom meetings, or the White House doesn't necessarily have to go back to Zoom meetings. They could have people still in person meeting. In theory, even with the president, if he is masked and you have good ventilation in that room, they could even meet indoors together. But you need to have those other layers there and to know when to use them. And of course, you want to have everybody in the workplace vaccinated and boosted, because that also helps mitigate the risk.
All right, Dr. Sengounder, stay with us. Thank you so much. We also want to thank Major Garrett and Nancy Cortez. We're going to take a short break, and then we'll have more on our breaking news.
President Biden has tested positive for COVID-19. We'll have more reaction to the diagnosis next. You're streaming CBS News.
CBS News Sunday Morning with Jane Pauley on CBS.
You ready?
A generation of kids opens up on CBS Reports.
I just want to be like a regular kid.
Their world, their struggles, their voices.
What if I was white?
A lot of people like to call names and make you feel ashamed for being proud of who you are.
Now streaming Gender.
I did not realize that you could change your gender.
Realizing how you feel.
You can be a boy, sometimes you feel like a girl, sometimes you feel like both.
Redefining who you are.
Identify as trans.
Gender fluid.
Non-binary and queer.
Is the idea of gender a thing of the past?
And to be yourself, always, no matter what anyone says, I love you.
Are the kids all right? Gender. Now streaming on the free CBS News app.
I'm Norah O'Donnell in our nation's capital. We're here at the White House with the President of the United States.
Thanks for having me. I appreciate it.
You've never done an interview like this before.
That's correct.
Tonight, a congressional investigation sparked by reporting from CBS News. What's your message to consumers?
They need help now. Tell him I feel it.
The CBS Evening News with Norah O'Donnell from Washington, D.C. on CBS and streaming on Paramount+.
We will witness yet another moment in history.
Want to go someplace new? Yeah, you do.
See something new.
Learn something new.
Meet someone new. Nate B in the house.
There's always something new under the sun.
CBS Mornings, weekdays.
When weather is about to get extreme.
We're talking about hail, we're talking about tornadoes, damaging winds.
Every second counts.
Let's now take a look at what that really means to you.
That's why CBS News and the Weather Channel have come together to bring you virtual weather technology so advanced, so real.
We can show you what it's going to look like when the storms come through.
You'll see what will happen, where it will happen, before it does. Feel the forecast on CBS News. Time to get prepared.
People from every corner of America facing challenges.
Everyone is just looking for some type of connection.
Just raise your hand and say, hey, I'd like to help.
Coming together to find solutions.
We are going to do something about it.
Their stories are our stories.
Welcome to Eye on America.
Stream now on the free CBS News app.
CBS News Sunday Morning with Jane Pauley on CBS.
We have an inspiring story that started with a strange act of kindness.
Yeah.
We found it.
You're kidding me!
We got it. We share stories that lift you up and brighten your day.
The Uplift. Stream on the free CBS News app.
Stories that inform, inspire, and brighten your day.
I've been waiting patiently for something like this.
Make every day a little more like Sunday morning.
Here comes the sun.
Stream on the free CBS News app Tuesday mornings.
Thank you for joining us. We're continuing to follow breaking news out of Washington, where President Joe Biden has tested positive for COVID-19.
That's right. The White House says Mr. Biden, who is fully vaccinated and twice boosted, tested positive this morning. We're told he will isolate at the White House and continue to work from home until he tests negative. The White House doctor says the president's symptoms are mild. He went to bed feeling fine, but had trouble sleeping and tested positive this morning.
Now we're going to bring in Reuters White House correspondent Jeff Mason. Hey, Jeff, who was with the president yesterday. Jeff, first of all, how are you feeling?
Appreciate the question. I'm feeling fine. We were pretty close to him, though, yesterday. The president did come and speak to reporters on the tarmac at Joint Base Andrews after his trip and sort of leaned in and was not wearing a mask outside. We were outside, and it wasn't a very long gaggle, as we call that. But we were close, so I'll certainly test myself at some point today and wish him a speedy recovery as well.
All right. And Jeff, we want to let our viewers know that the president has just tweeted. Let's show our viewers this tweet. This is actually my first time seeing it. It says, folks, I'm doing great. Thanks for your concern. Just called Senator Casey, Congressman Cartwright, and Mayor Cognetti, and my Scranton cousins to send my regrets for missing our event today. Keeping busy. There he is. So, Jeff, presumably this is at the residence, we're assuming, as we understand.
It's not the Oval Office.
It's not the Oval Office, but we were under the impression that he was isolating in the residence in the White House. But, Jeff, tell us what was...
Now, okay. I mean, now the question is who took that photo.
Yeah, the question is...
It's not a selfie.
That's right. So, Jeff Mason, if you're seeing this, and I don't know if you can hear me, I know we're having some trouble with your connection, but the president is isolating, correct, in the residential part of the White House?
I can hear you, yes, and yes, he is isolating. The president basically has to isolate for the next 5 days in order to stay in line with CDC guidelines. So he was supposed to travel to Pennsylvania today and then go on to Wilmington. That trip has been canceled. But he does look pretty good in that picture, as you say. No idea who would have taken it. Perhaps one of the White House photographers, keeping a little bit of distance. But you know what? I think to the broader sort of political message here, the president is wanting to show that he can work through COVID. Probably also wants to demonstrate that when he says he's only suffering mild symptoms, that's true. And the symptoms are such that he can continue to do his job. But he's going to follow CDC guidelines and keep to himself.
Now, Jeff, we were talking to Major a bit about this, but, we were talking COVID is really disruptive, and it's been really disruptive in all of our workplaces, and the White House is not exempt from that. So now we've seen that, at the most important office building, one could argue, in America. What are you going to expect to see among the staff, among the function of the White House? Do you think we'll really be able to see business as usual just with him working from home like some of the rest of us have had to do when we get infected? Or is this going to throw a wrench in some of the plans and some of the objectives the White House had, especially ahead of these what are expected to be a pretty tough midterm elections for Democrats?
Absolutely. There's a couple different factors to keep in mind when answering that question. Number one, does him having COVID, does that lead to a larger or a broader outbreak in the White House? There were certainly a bunch of staff on Air Force One yesterday, along with lawmakers and press and Secret Service. If that does become a broader outbreak, that will certainly impact how the White House works. The fact that he's working from home, sure, of course, that changes the regular rhythm of him being able to come into the Oval Office or meet with people in person. But if his symptoms stay mild, and we all hope that they do, then he will do just kind of like what we do, is continue to work from a different location, your house, in this case, the upstairs of the White House, but continue doing the work of being president of the United States. To the second part of your question, what other protocols will we see? It's important to keep in mind that the protocols are still pretty strict at the White House, at least for people who get close to the president. So that includes the White House press pool and staff who are in close contact with him on a regular basis or physically. As we've discussed before, others who don't necessarily get as close, other reporters, for example, from the press corps, are not required to be tested every day. Will that change? My guess is the answer to that is no, because they also want to show that this country, this White House, can continue to live with COVID, even though cases are going up.
So, Jeff, we know that contact tracing is going on, but what can you tell us about your time with the president yesterday, his interactions, and, overall, what did you see with regard to the president's health?
Well, I observed a president yesterday who was in good health. I certainly did not notice anything suggesting symptoms yesterday. He was in good spirits. He was hanging out with lawmakers on the plane and then visiting with John Kerry, his climate envoy, yesterday after the event in Massachusetts, where he was talking about climate change. When we landed at Joint Base Andrews at the end of his trip, as I mentioned before, he came over and spoke to reporters, and I was in that group. He doesn't always do that. I don't think he would have done that if he wasn't feeling well yesterday. So he looked like, he looked in normal spirits and in normal health throughout the day yesterday into the early evening when I had eyes on him anyway.
All right, Jeff Mason of Reuters. Jeff, we hope you are okay. Thank you so much for joining us. We really appreciate it.
Thanks, Jeff. We're continuing to follow breaking news out of the White House. President Biden has tested positive for COVID-19.
We're going to have more on this breaking story just after this short break. You're streaming CBS News.
CBS News Sunday Morning with Jane Pauley on CBS.
You ready? A generation of kids opens up on CBS Reports.
I just want to be like a regular kid.
Their world, their struggles, their voices.
What if I was white?
A lot of people like to call names and make you feel ashamed for being proud of who you are.
Now streaming Gender.
I did not realize that you could change your gender.
Realizing how you feel.
You can be a boy, sometimes you feel like a girl, sometimes you feel like both.
Redefining who you are.
Identify as trans.
Gender fluid.
Non-binary and queer.
Is the idea of gender a thing of the past?
And to be yourself, always, no matter what anyone says, I love you.
Are the kids all right? Gender. Now streaming on the free CBS News app.
I'm Nora O'Donnell in our nation's capital. We're here at the White House with the President of the United States.
Thanks for having me. I appreciate it.
You've never done an interview like this before.
That's correct.
Tonight, a congressional investigation sparked by reporting from CBS News. What's your message to consumers?
They need help now. Tell him I feel it.
The CBS Evening News with Nora O'Donnell from Washington, D.C. on CBS and streaming on Paramount Plus.
We will witness yet another moment in history.
Want to go someplace new? Yeah, you do.
See something new.
Learn something new.
Meet someone new. Nate B in the house.
There's always something new under the sun.
CBS Mornings, weekdays.
When weather is about to get extreme.
We're talking about hail, we're talking about tornadoes, damaging winds.
Every second counts.
Let's now take a look at what that really means to you.
That's why CBS News and the Weather Channel have come together to bring you virtual weather technology so advanced, so real.
We can show you what it's going to look like when the storms come through.
You'll see what will happen, where it will happen, before it does. Feel the forecast on CBS News. Time to get prepared.
People from every corner of America facing challenges.
Everyone is just looking for some type of connection.
Just raise your hand and say, hey, I'd like to help.
Coming together to find solutions.
We are going to do something about it.
Their stories are our stories.
Welcome to Eye on America.
Stream now on the free CBS News app.
CBS News Sunday Morning with Jane Pauley on CBS.
We have an inspiring story that started with a strange act of kindness.
We found it.
You're kidding me!
We got it.
We share stories that lift you up and brighten your day.
The Uplift. Stream on the free CBS News app.
Stories that inform, inspire, and brighten your day.
I've been waiting patiently for something like this.
Make every day a little more like Sunday morning.
Here comes the sun.
Stream on the free CBS News app Tuesday mornings.
Welcome back to CBS News. I'm Elaine Quijano.
And I'm Christina Ruffini. We're following breaking news. President Biden has tested positive for COVID-19. The White House says he has, quote, very mild symptoms. The president has been vaccinated twice against the disease.
John Moore, professor of microbiology and immunology at Weill Cornell Medical College, joins us now for more. Professor, welcome. Thanks very much for being with us. So, given that President Biden tested positive today, when might he have caught it? And when about should he start testing negative again?
Probably he would contract it within the last 48 hours. And I believe he was recently on a trip, so that would be one possible source. Testing positive, at least a week in all probability, perhaps a bit longer. It depends on whether you're using a rapid antigen test or a PCR test. PCR test will detect positivity for longer, but may not indicate infectiousness.
Do you know, or do we have any idea what the variant the president might have gotten? And what do we know about the different variants that are prevalent right now? Like, he was traveling in the Middle East. Is he more likely to have gotten something other than what we're seeing running rampant through parts of the U.S.?
Well, that's possible that a foreign trip could expose him to a variant that's not common in the States. But the most likely eventuality is he's contracted one of the late Omicron variants, BA4 or BA5, which are highly prevalent worldwide and dominate in America. So it's not certain that he would have got infected on the Middle East trip. He has been out of the White House since he returned. So we just don't know. It's probably going to be never known. But most likely he's got an Omicron variant. And he will, of course, be getting literally the best healthcare in the world. And as a doubly vaccinated individual, he's highly unlikely to progress to severe disease. So he will face a week, perhaps, of feeling under the weather. I mean, the most common symptom that's being reported for these Omicron lineage viruses is a sore throat, which can be, quite a bad sore throat in some people. Maybe congested, just may feel under the weather, but it's unlikely that anything worse than that will happen. He's probably also receiving antiviral therapy, Paxlovid. That would be standard of care for someone in his age group and stature.
So I'm curious about what you can tell us with respect to BA4 and BA5, John, and transmissibility. What differentiates those two sort of latest variants from the previous variants that came before? Because as we saw in this photograph that was tweeted out by the president, he's not wearing a mask. And presumably there may have been a photographer in the room capturing that image. What do we know about BA4 and BA5 and how transmissible it is?
Well, my guess is the photo was taken with a long lens from a doorway that's probably tens of feet away. So I doubt that the photographer would have been deliberately exposed to anything risky. BA4 and BA5 are the latest in an Omicron lineage that started in around December of last year. We've been dealing with Omicron infections all year, and they were somewhat of a game changer because they're so transmissible. And one of the reasons they're so transmissible is that they have acquired the ability to resist virus-neutralizing antibodies, which are our major defense against infection. So these variants can now blow past the antibodies that are induced either by vaccination or by a previous infection or by both. Now, there's still some protection by these antibodies, whether vaccine-induced or infection-induced, but they're much less protective than they were in 2021 against the viruses that were then circulating. So they're much more likely to infect a vaccinated person than we were used to in 2021. And it's just been a progression from BA1 to BA2 to now BA4 and 5, and the properties have exacerbated each time a new subvariant has come along.
Is this a surprise how rapidly these subvariants have been able to get around these antibodies that people either built up through vaccinations or boosters? Or, I mean, heck, getting COVID multiple times, people thought, oh, thank goodness I've gotten it, at least I'm clear, and now they're getting it 2 and 3 and 4 times.
I mean, should people be masking up again, I guess is the other question. From your perspective as someone who studies these and who sees the effect that these subvariants are able to have on the body and how the protective kind of things that were in place before against the earlier versions of the virus don't seem to offer that same kind of protection now.
Well, mask wearing has always made sense. It's always been something that people should have been doing and should continue to do. And I'm working within the walls of a medical school. It's mandatory if I'm outside this office. I'm by myself here, so it's irrelevant. But if I'm outside this office, it's required that I wear a mask, and everyone does, because it makes sense. We have to protect each other and the patients who also visit the hospital. I wear a mask if I'm on the New York subway. I wear a mask if I go in a grocery store. I don't wear one walking down the street because that's a minimal risk. So we need to be aware. The virus has not gone away. The Omicron variants are circulating widely. The recorded number of infections a day in America is around 130,000, but we all know that's underestimated by a factor of perhaps 4, because when people are testing positive using at-home kits, they're not reporting their infection to CDC or the local Department of Health. That's not happening. So there's probably 500,000 Americans a day getting an BA4, BA5 Omicron infection. People want the virus to have gone away, but it hasn't. So there's risk in doing daily life. Now, but what has changed is that the vaccinations and infections that we've accumulated as a population have stopping most people from progressing to hospital and dying. The death rate in the States at the moment, which is well recorded, is around 300 to 400 a day, which is a high number. We shouldn't be blasé about it. But the peak in early 2021 was over 3,000 a day. So we're only at 10% of that. And I think people have just assumed, because there's a much lower risk of death, that they can relax their guard and seem willing to tolerate these generally at-home, relatively mild, but still unpleasant infections. No one should want to get infected. I mean, my daughter is recovering from an Omicron infection now. She had a very bad sore throat and still feels congested after a week, but she's healthy, she's young, she'll be fine. Most people will be, but you're still going to have, in all probability, not a great week if you get infected. So why take the risk if you can avoid it?
Why take that risk? All right, John Moore with Weill Cornell Medical College. John, thank you so much for sharing your insight with us. Chris McGarrian is a White House reporter with the Associated Press, and Chris joins us now with more. Chris, thanks very much for being with us. So what can you tell us at this moment about how the White House is handling President Biden's COVID diagnosis? We saw earlier there is a tweet with the president at a desk and a message clearly wanting to project that things are going on despite
business as usual, or business as close to usual as they can get it.
He says keeping busy to close out that tweet. Chris, what can you tell us about the White House's approach here?
Yeah, I think that's exactly right. They want the country to feel like things are fine. They want people to understand that the president is doing well and that he's, taking care of business and that he's not been, laid up by this virus. There's also, that's partially a public health message. The president's been vaccinated twice, boosted twice. They want the public to feel like these vaccines are still effective, even if the Omicron subvariants can sometimes work around them because these shots prevent a severe disease. And they want the country to feel like it's still in good hands, even though the president has this virus.
And Chris, the president was supposed to speak about gun violence today. He's been discussing the economy. Now this, how would you think this diagnosis is going to derail the president's agenda and what he's been trying to get done, especially ahead of these midterm elections?
Sure. Well, definitely it's going to keep him off the road for a little bit. He won't be, speaking about gun violence today in Pennsylvania or attending a fundraiser in Philadelphia. He was going to spend a long weekend in Delaware. And then there was more trips, expected in the near future as well. So this could definitely push some of that back. If this continues to be a mild case of COVID, he'll likely be on the road and back to his normal activities, in a little more than a week. However, to send the message that, the country is moving past the virus, that's something that's a little bit more difficult after he gets it himself, given all the precautions that are put in place to keep him from getting infected.
All right, Chris McGarrian. Chris, thank you so much. Let's bring in CBS News political reporter Caitlin Huey-Burns, joining us now from the North Lawn of the White House. So, Caitlin, we have been hearing about how the president is doing right now. We saw that picture of the president that was tweeted out not that long ago. What can you tell us about what's on the schedule today in terms of briefings? Are we expecting to hear from any White House officials today?
Well, we are going to hear from White House Press Secretary Karine Jean-Pierre in the 2 p.m. hour, so we will get an update about the president and his condition. But it is clear that the White House being here today, they want to project this image of the president at work, that even though he has had to cancel his events, he was supposed to go to Pennsylvania today for 2 different events. Those are, of course, canceled, that he is still at work. So even in the statement that was released announcing that he had COVID, they said that he will continue to be on the phone, that he'll be on Zoom and conducting business with these, quote, very mild symptoms. We also know that he has spoken with members of Congress from Pennsylvania and others with whom he was supposed to meet. Bob Casey, the senator from Pennsylvania, said that President Biden called him and said that he's feeling fine and that he hopes to be back in Pennsylvania at another point. But it is important to note that the president, was just on the road yesterday, and he had close contact with at least 3 senators, a couple of House members, a governor, and a variety of different staff. So here at the White House, they're essentially trying to do some contact tracing, trying to figure out who else the president had been in close contact with. And of course, he just returned from that trip abroad in Saudi Arabia just on Sunday.
That's right, Caitlin. We were talking to Jeff Mason from Reuters yesterday, who said he was on that tarmac speaking to President Biden. It was loud. He's a close talker. Chris and I have been on Air Force One sitting next to each other. We're talking to officials, talking to the president during that trip. It's not, as you know, it's not a lot of space in a lot of those places. So are you noticing today at the White House grounds, are you noticing any different protocols since you've been there? Are you seeing more people putting on masks, staff, reporters? What can you tell us about what you're seeing there?
Yeah, that's a really good question, Christina, because we were on air, most of the morning. And then when I walked back to that press file, which, as you both know, is a very tiny space, most of the reporters and members of the media were wearing masks. And that's because a lot of them were actually traveling with the president, as you mentioned just yesterday. We were talking a lot about how this feels so very different from when then President Trump got COVID. And Christina, I know you were there at Walter Reed covering that as well. We've, of course, since had the vaccine. The White House has been, reminding people that he's been vaccinated, been boosted twice. He was boosted last in March. He last had his physical in November. And this is a White House that just treats this very differently than the previous administration does. When we are part of the pool covering the president, we are required to take a COVID test, required, of course, for it to be negative before being able to participate in the pool. So the requirements are different. But, over the past, several weeks, that hasn't been the case. People have not been wearing masks here. People are vaccinated and boosted. But today feels different in light of this news.
And Caitlin, I wonder, as far as other officials in the West Wing, as far as the First Lady, what do we know about their own sort of COVID status right now, the Vice President? What can you tell us on that front?
Well, both the Vice President and the First Lady have tested negative. They are both also traveling at the moment. We know that the First Lady went to Connecticut while Biden was in Massachusetts. She is also going to continue her schedule. She's expected to go to Michigan and Georgia, and she's going to spend the night tonight in Wilmington. So she is continuing her schedule, and she spoke to the press earlier today, saying that she spoke to her husband and that he is feeling fine, and that she did test negative. Vice President Kamala Harris is on the road today as well. She's expected to come back tonight. She has also tested negative. And of course, the president's schedule is now canceled in terms of travel for the rest of the week. He was supposed to go to Wilmington, Delaware this weekend. And of course, he will remain here at the White House in the residence, isolating until he tests negative.
All right, Caitlin Huey-Burns on this developing story. Caitlin, thank you so much.
Never a slow day at the White House.
Never
Thanks,
a slow
Caitlin.
day. All right, we are going to take a short break, but now is a good time to remind you can stay up to date by downloading our CBS News app.
Stay with us. You're streaming CBS News, always on.
CBS News Sunday Morning with Jane Pauley on CBS.
You ready? A generation of kids opens up on CBS Reports.
I just want to be like a regular kid.
Their world, their struggles, their voices.
What if I was white?
A lot of people like to call names and make you feel ashamed for being proud of who you are.
Now streaming Gender.
I did not realize that you could change your gender.
Realizing how you feel.
You can be a boy, sometimes you feel like a girl, sometimes you feel like both.
Redefining who you are.
Identify as trans.
Gender fluid.
Non-binary and queer.
Is the idea of gender a thing of the past?
And to be yourself, always, no matter what anyone says, I love you.
Are the kids all right? Gender. Now streaming on the free CBS News app.
I'm Norah O'Donnell in our nation's capital.
We're here at the White House with the President of the United States.
Thanks for having me. I appreciate it.
We've never done an interview like this before.
That's correct.
Tonight, a congressional investigation sparked by reporting from CBS News. What's your message to consumers?
They need help now. Tell him I feel it.
The CBS Evening News with Norah O'Donnell from Washington, D.C. on CBS and streaming on Paramount Plus.
We will witness yet another moment in history.
Want to go someplace new? Yeah, you do.
See something new.
Learn something new.
Meet someone new. Nate B in the house.
There's always something new under the sun.
CBS Mornings, weekdays.
when weather is about to get extreme.
We're talking about hail, we're talking about tornadoes, damaging winds.
Every second counts.
Let's now take a look at what that really means to you.
That's why CBS News and the Weather Channel have come together to bring you virtual weather technology so advanced, so real.
We can show you what it's going to look like when the storms come through.
You'll see what will happen, where it will happen, before it does. Feel the forecast on CBS News. Time to get prepared.
People from every corner of America facing challenges.
Everyone is just looking for some type of connection.
Just raise your hand and say, hey, I'd like to help.
Coming together to find solutions.
We are going to do something about it.
Their stories are our stories.
Welcome to Eye on America.
Stream now on the free CBS News app.
CBS News Sunday Morning with Jane Pauley on CBS.
We have an inspiring story that started with a strange act of kindness.
Yeah. We found it.
You're kidding me!
We got it.
We share stories that lift you up and brighten your day.
The Uplift. Stream on the free CBS News app.
Stories that inform, inspire, and brighten your day.
I've been waiting patiently for something like this.
Make every day a little more like Sunday morning.
Here comes the sun.
Stream on the free CBS News app Tuesday mornings.
And in other news today, we are hours away from the 8th and final day of public hearings by the Special House Select Committee investigation into the January 6 riots.
The panel is hoping tonight's primetime hearing will lay out a foundation for a case against the former president. Each public hearing has focused on a different portion of events surrounding the insurrection. Tonight, House lawmakers will be honing in on the former president's alleged